Mr. Deputy Speaker, sir, today my fellow co-chairs of the Multi-Ministry Task Force, the MTF, Minister Gan Kim Yong and Minister Lawrence Wong, and I will be delivering ministerial statements to update members on the COVID-19 situation in Singapore. Our ministerial statements will address oral questions 1 to 5 and 26 to 28, and written questions 28, 29, 31 to 33 of today's order paper. It will cover questions on the KTV and Jurong Fishery Port clusters, our COVID-19 vaccination program, and our plans to transit to live normally with COVID-19. Mr. Murali Pillay, Associate Professor James Lim, Mr. Darrell David, Mr. Xie Yao Chen, Mr. Yip Hon Wing, Mr. Seah Kim Peng, Ms. Raisa Khan, and Mr. Sito Yipin have filed oral and written questions scheduled for future sittings on these issues. As today's ministerial statements would address those questions, Mr. Deputy Speaker, sir, I would like to invite these members to seek clarification should they have on these issues after the ministerial statements. And should their queries be sufficiently addressed, it may not be necessary for them to proceed with their PQs for future sittings. With that, let me start. On Monday, 12 July 21st, MOH detected several COVID-19 positive cases amongst individuals who frequented KTV, bars, and lounges. These individuals included patrons of the bars and hostesses who worked in the lounges. These activities were considered very high risk and had been disallowed since the beginning of the pandemic. The cluster grew rapidly, and MOH moved in quickly to isolate infected persons. We identified rings of contacts and tested them for COVID-19. We ordered a 2-week suspension of operations in all pivoted nightlife establishments from 16 July till 30th July. The pivoted nightlife establishments cannot resume operations until they pass inspections to ensure that safe management measure protocols are in place and they have received written approval. Mr. Xie Yao Chen asked if we would consider making the individuals in the KTV cluster pay for their COVID-19 medical expenses in full. We are all upset by the irresponsible behavior of the individuals involved in this KTV cluster. But we still have a public responsibility to ensure that everyone receives the medical care that they need. We also do not want individuals, especially those who are infected, to avoid getting tested and treated or hide where they have been from contact tracers because they are afraid of getting penalized. And this will make it harder to contain the spread and would cost us more in the long run. We were on the path towards progressive opening, and the KTV cluster was a major unexpected bump on the road. The MTF deliberated on the matter, took in advice from MOH experts, and came to the conclusion that given our extensive tracing and testing efforts and our population vaccination rate for 2 doses were approaching 50% at that time, on balance, we felt that the cluster ought not significantly change our plans to open up. Hence, on 16 July, the MTF announced our decision to maintain our then current safe management posture. We made some adjustments to the rules for eating in restaurants. We call it the 2-5 rule. 2 if you are unvaccinated, 5 you can dine together, provided everyone is vaccinated, is fully vaccinated. Based on how the cluster has developed, we still believe that was the correct call. As of 25th July 2021, that means yesterday, end of yesterday, the KTV cluster has a total of 237 infected persons. For the past 3 days, the daily increase in infection for the cluster was 6, 5, and 5 respectively. So it is coming under control. But unfortunately, things got derailed due to a larger and more troublesome cluster. And this is the Jurong Fishery Port cluster. On the evening of Friday, 16 July 2021, we started to detect multiple infections at the Jurong Fishery Port, as well as in Hong Lim Market. This involved fishmongers, their assistants, going about an honest living, collecting fishes at the fishery port, but unwittingly getting infected and then transmitting to more people in the markets and communities where they ply their trade. MOH, with the help of NEA, took immediate steps to prevent further spread by stopping the fishmongers and their assistants from setting up stalls on Sunday, 18th July 2021. It was very tough to tell them you can't set up stalls. We then issued health risk warnings, which required them to undergo PCR tests and isolate themselves until they get a negative result. Of the 1,548 tested, 43 were found to be COVID-19 positive. The numbers are a bit different from what I reported earlier as we clean up the numbers. This indicated that significant community transmission had most likely already silently occurred in the days before 18th July 2021 Sunday. See, markets are frequented by wide segments of the public, particularly seniors, of whom 1/4 are still not fully vaccinated. The risk of infections rising uncontrollably could not be ruled out. These infections could potentially result in more cases of severe illnesses or even deaths among our vulnerable senior population. Hence, the MTF decided to preemptively dial back to phase 2 heightened alert. This came into effect on 22nd July 2021. We did this to buy ourselves time, precious time, to get more of our population vaccinated, so that we can continue on our path towards living with COVID-19 safely. The preliminary phylogenetic findings suggest that while the KTV and Jurong Fishery Port clusters were all driven by the Delta variant, it is distinct from the Delta variant that infected Tan Tock Seng Hospital and the Changi Airport clusters. The recent clusters have a Delta strain that is more closely related to what we detected in imported cases from our immediate region. However, there are also slight genetic differences between the strains in the two clusters, suggesting that there were multiple introduction points. As of July 25th, 2021, the Jurong Fishery Port has a total of 792 cases. It is still growing, but now at a slower rate. The daily infection numbers over the last 3 days were 79, 79, and 46, respectively. Overall, we have seen a high number of daily cases at over 100 for the past several days. But the situation is stabilizing, with daily infections trending down. Percentage of cases isolated or quarantined before turning COVID-19 positive is something we watch closely, and it is on an upward trend, which is good. That means when the person is started to be detected as positive, he's already quarantined and isolated. On 19th July, that's when the cluster first broke out, we had a total of 163 cases, and only 27% were isolated before detection. Lately, this hovers around 40%. Today, we should have more than half of our cases already isolated. If we can keep raising that percentage through tracing and testing, we can progressively suppress this wave of transmission. But our objective is not to stop transmission completely. That is no longer possible, given how transmissible the Delta variant is and as we open up and people circulate more. So the only possible way now to eradicate infections is to go into a hard circuit breaker for at least a month, probably two. But we don't want to be locked up. Further, even if we do lock ourselves up, when the CB ends and we open up, cases will rise again. So eradication is therefore not possible nor sustainable. We must instead find ways to live with this virus safely. Several members, namely Mr. Yip Hong Wing, Associate Professor James Lim, Ms. Raisa Khan, were interested to find out more about our transition plans to live with COVID-19 as an endemic disease. Vaccinations are key to this transition, and the national program is progressing well. As of end of yesterday, 25th July 2021, 54% of our population has received 2 doses of the mRNA vaccines. And our population vaccination rate is going up by about 1 percentage point a day. So by National Day, almost 70% will have received 2 doses. By early September, it should be almost 80% having received 2 doses of mRNA vaccines. And this means Singapore, by then, will have one of the highest vaccination rates in the world. It puts us in a strong position to transit to a COVID-resilient society. Our main worry is that our seniors, especially those 70 and above, are not sufficiently vaccinated. Today, just over 70% of them have received 2 doses of the vaccines. Ms. Ting Pei Ling asked for an update on the home vaccination scheme. We have launched 9 home vaccination teams so far. As of 23rd of July, 734 seniors have received vaccinations under that program. Further, more seniors are coming forward to our vaccination centers and also our mobile vaccination teams. We have been seeing about 500 seniors coming forward on a daily basis to receive their first doses for the past a few weeks. But for the past few days, that number has doubled to over 1,000 every day now. How did that come about? It's good news, but it may be due to heightened awareness as a result of more community transmission, lifting of rules that had previously deferred their vaccinations for those with medical conditions, and also our very intensive outreach efforts. For example, our mobile teams have gone all the way to Pulau Ubin to vaccinate seniors who are living there. We know of GPs who called up their clients, the seniors, persuaded them, go for vaccinations, and then open up their clinics for them to sit in the clinic the whole day so that they feel assured that if they feel unwell, help is always nearby. Help from someone they trust, their GPs. Mr. Deputy Speaker, sir, this is a measure of the kind of society we are. We are making such an extraordinary effort with our seniors because we are not prepared to accept the high fatality rates amongst the elderly that other countries had or are still experiencing. As a result of all these efforts, 77% of our seniors, 70 and above, have now received their first doses. Within a month or so, they should all have received their second doses. And after that, another 14 days, they should all be strongly protected against COVID-19. Even at our current rate of vaccination, 54% or so, 2 doses, the preliminary evidence is that it has been effective in reducing the incidence of severe illnesses and deaths. Mr. Deputy Speaker, sir, may I show a chart on screen, please?
Yes, please do.
Thank you. Top line is blue line is infection. Bottom line, orange, is number with severe illnesses requiring oxygen supplementation or ICU. As members can see, while daily infections have gone up sharply over the past couple of weeks, the number of patients with severe illnesses who require oxygen supplementation or in ICU remains relatively low. There's slight uptick, but relatively suppressed. Currently, all of these patients with severe illnesses are either unvaccinated or partially vaccinated. But we are watching this closely because there is a time lag of 1-2 weeks between infection and the onset of severe illnesses. For now, it would appear that we have successfully weakened the link between infections and severe illnesses. While we are making good progress in vaccinating our people, we acknowledge that the recent reversion to phase 2 heightened alert has caused some confusion amongst members of the public. They are asking, are we still committed, or is the MTF still committed to the path towards normalcy and living with COVID-19? The answer is a definite yes. For that is the only way for Singaporeans to regain our lives and livelihoods, for Singapore to reconnect with the world again, for our young to look into the future with hope. Some countries like the UK have declared a Freedom Day recently, where all social restrictions are lifted all at once. Others, like Israel and Netherlands, opened up and saw sharp increases in infections and hospitalization and have to dial back very quickly. Ours will be a controlled opening. We are not going to do a big bang because predictably things will then blow up. The MTF has been developing a roadmap comprising packages of measures to be implemented step by step over the next few months, and with every step, ensure that opening up is safe for the community. But even as we do so, we must bear in mind that until we reach a sufficiently high vaccination rate, especially amongst our senior, we will continue to be vulnerable to unexpected setbacks, just like what we are going through now. A high rate of vaccination will provide us with a more solid and stable base as we proceed on this journey. The higher the vaccination rate, the more solid the ground we walk on. So in a way, this is the most peculiar period of our transition, where we are clear about our mission, our will is firm, we have a broad plan, but we don't have enough antibodies in all of us to ensure that we can follow through our plans without a hitch. But let us not underestimate the progress we have made. The roadmap is in fact being implemented as we speak. Our attention often is on the SMMs, the safe management measures, such as whether we can eat in restaurants. But there are at least 3 other important aspects, namely, 1, restoring economic and social activities, including connecting with the outside world. 2, remodeling COVID-19 healthcare protocols. And 3, shifting our collective psychology, which I feel is probably the hardest. Minister Gan will speak about restoring economic activities, while Minister Lawrence Wong will speak more about enabling more social activities. Let me talk about healthcare protocols and our collective psychology. As we learn to live with COVID-19, our healthcare protocols must be remodeled. If COVID-19 is indeed endemic, having 200 or more cases may not be an unusual thing at all. During an influenza season, our daily infection rates can go up to as high as 1,000 a day. Imagine we treat influenza like we treat COVID-19. This is what will happen. We will put everyone suspected of influenza infections through PCR tests, and then long isolated stays in hospitals. And then everyone they come into contact with will be quarantined. 1,000 cases a day. This will disrupt the lives of many people. Further, hospital beds will all be filled, and many other patients who are sicker will be turned away. The healthcare system will not be able to cope, and that is clearly not the way to deal with an endemic disease. So if we want to live with COVID as an endemic disease, we cannot carry on with the current healthcare protocols. They need to shift closer to how we treat influenza today, without extensive contact tracing and quarantine in dedicated facilities, and hospitalizing only those who are very ill. But that can only happen when the likelihood of developing very serious or life-threatening disease as a result of COVID-19 infection has been significantly reduced by effective vaccination of our population, especially amongst the vulnerable. With our current rate of vaccinations, we have started to take the first transition step to remodel our healthcare protocols. As of last week, we made the following changes. First, greater use of community care facilities instead of hospitals. Vaccinated individuals aged between 45 and 59 who tested positive for COVID-19 and show no or mild symptoms can be directly admitted to community care facilities instead of going first to hospitals. So these community care facilities currently is, for example, is NTUCD resorts, as well as CSC Loyang. This was already the practice for all cases aged between 17 to 45 years, but we are now expanding the protocol to people up to 59 years old. And with this change, we expect up to 60% of infected cases to recover in community care facilities instead of in acute care hospitals. Meanwhile, we will plan for the next step, because this is just the first step. We'll plan for the next one, where perhaps 80% can be admitted to community care facilities, and some can even start to recover at home. Second change, we have shortened the length of stay in hospitals and community care facilities. Our tests have shown that the viral load in infected persons who are fully vaccinated falls very rapidly to a very low level after 9 days. Previously, most people generally were discharged only after 21 days. We are now discharging fully vaccinated persons after 14 days from the onset of illnesses, with a 7-day leave of absence in addition, so long as their tests show that they are COVID negative or have very low viral loads. We are reviewing our policy to allow fully vaccinated patients to be discharged even earlier and to complete the rest of the isolation period at home if their home environment is suitable. Third change is the greater use of home quarantine. For fully vaccinated persons, they can now serve their quarantine at home instead of a dedicated government facility, provided that their home is suitable for isolation. We expect up to 40% of persons under quarantine can serve their quarantine at home, and this will go beyond 50% in the coming few weeks as more people get vaccinated. These are amongst the first steps that we will take in the healthcare transition. In the meantime, what we are experiencing in this current wave of transmission is also valuable because we are also witnessing a palpable shift in our collective psychology. The first, I think, is a shift away from always focusing on infection numbers. We used to get a shock when we see high daily numbers because this will mean a week or two from then, we will see more severe illnesses and deaths. However, in recent days, that mental link is starting to be broken, as we know that with vaccinations, high infection numbers need not necessarily mean more sickness and deaths. Many people are now rightfully focusing on the number of people with severe illnesses. As of today, despite the higher infection cases over the past few days, that number is 14 and does not threaten our hospital capacity. Many friends, including members of this House, have been texting me, asking me, why don't we publish the number of people with severe illnesses so that we know that vaccination works? Actually, the media have been publishing these numbers every day for quite a while now. But our attention is always on the vaccination, on the infection numbers. But it is good that the attention is now shifting. I wouldn't say there's a huge psychological shift, but I think the shift is starting to happen. A second shift is a greater acceptance of differentiated safe management measures between those who are vaccinated and those who are not. There have been many calls to do this. Mr. Xie Yao-chen has also asked about this. This is something which the MTF has always intended to do, and that was why we decided on the 2-5 rule for restaurants when the KTV cluster broke out. But it was scuttled with our reversion to phase 2 heightened alert. When our whole society is very highly vaccinated and we have transitioned to living with COVID-19, we should make very little differentiation between the vaccinated and the unvaccinated. But during this period of transition, when we are still building up our resilience, differentiation by vaccination status is a practical way to open up some activities first while protecting those who are still vulnerable. MTF will visit this during our Phase 2 Heightened Alert Midpoint Review, and Minister Lawrence Wong will speak more about that later. Let me address several other questions from members. Mr. Murali Pillay will be comforted to know that MOF actively monitors international developments in medical treatment options for COVID-19. This is done through the National Center of Infectious Diseases, NCID, and an expert committee. They have developed national treatment guidelines which are constantly updated based on new evidence. They provide guidance to our doctors on the use of evidence-based medical treatment options for COVID-19 patients. Our local institutions have also been participating actively in international multi-center trials investigating novel COVID-19 therapeutics. These trials have generated important data on new COVID-19 treatments, such as remdesivir. We will continue to closely monitor developments in COVID-19 treatments, proactively procure therapeutic agents which are shown to be effective, and maintain a stockpile based on our population needs. To Mr. Leon Pereira's question, factors that affect COVID-19 vaccine efficacy are an area of active study in Singapore. Persons who have contracted COVID-19 are clinically assessed for risk factors, and scientific papers on the correlations may be published in future. Antibody testing is not required after vaccination under Singapore's National Vaccination Programme, and we are actively reviewing the need for vaccine boosters. We are also continually reviewing Singapore's portfolio of COVID-19 vaccines. We plan to bring in non-mRNA vaccines that are robustly assessed for quality, safety, and effectiveness. This should happen before end of the year, subject to supply and regulatory approval. Testing, that will remain very important, even as we transit to living with COVID, because it is only through testing that we can know if we are infected and then do the civic-minded thing in excusing ourselves from work and then staying home. But we have to make testing simple, accessible, affordable, even more so than now, so that we can all do our part. I believe many members have done the breathalyzer testing just now, so it is one example of a test that is non-intrusive, simple, easy, accessible, and fast. Since mid-June, we have progressively rolled out regular, fast and easy tests for staff working in higher risk settings. These include a network of 16 quick test centers, which we intend to expand further. So in response to Ms. Joan Pereira's question, the quick test centers will support small businesses by allowing their staff to walk in and get themselves tested and have their results recorded. At some point, I believe, the quick test centers should also be using breathalyzer tests, as we have gone through just now. We will also continue to work with NEA to deploy wastewater testing across Singapore. Mr. Dennis Tan asked about this. Currently, NEA has deployed 270 auto-samplers across 200 sites. So every site can have a few, 2 or more auto-samplers. We are increasing this to 500 auto-samplers across 400 sites by the end of the year. Wastewater testing is an increasingly strategic resource as we learn to live with COVID-19. Where we place the sites are very important. We can deploy them in areas where we suspect transmission is happening, such as around all the markets that are currently affected now, or we can deploy them to areas where we know many unvaccinated seniors are living there. Such testing is non-intrusive and would give us valuable early warning when COVID-19 starts to take hold in a locality. We'll know very early, and that will prompt us to take further public health measures in the affected residential areas. Mr. Darryl David, Dr. Lim Wee Kiak, and Mr. Murali Pillay asked about the safety of COVID-19 vaccines. MOH has been publishing monthly safety data updates on our website. It also gives an age breakdown of the affected persons, and indeed, the majority are young people. As of 30th June 2021, HSA has received 12 reports of myocarditis and pericarditis occurring in persons after receiving a dose of the mRNA-based COVID-19 vaccine. While there is a small increased risk among those in the younger age groups relative to the baseline rate, the local incidence rate remains low. One of the reported cases is a full-time national serviceman in the SAF who is below 30 years of age. None of the cases are from the Singapore Police Force or the SCDF. We implemented the Vaccine Injury Financial Assistance Program, or VFAP, to give greater peace of mind to people taking vaccinations. But remember, with or without vaccinations, there is a baseline number of disease cases amongst our population. Since the vast majority of Singaporeans have stepped forward to be vaccinated, there will naturally be numerous incidents which just happen to coincide with vaccinations. Hence, we have to do what is practical and reasonable, which is to have a VFAP, which is to have the VFAP applications reviewed by a panel of medical experts who will consider them against known evidence about the vaccines. A few members have also asked about the Sinovac vaccine. The Sinovac vaccine is called CoronaVac, but we always just call it Sinovac. Sinovac is the company. The vaccine is CoronaVac, but for simplicity, I'll just refer it as the Sinovac vaccine. As at 25th July 2021, about 72,000 persons have received at least one dose of the Sinovac vaccine, and about 17,000 persons have received their second doses. Amongst them, 28% are Singapore citizens, and they are mostly young. So for those who have taken the Sinovac vaccine and are seniors above 60 years old, only 10%, or in fact less than 10%, are Singaporeans. If the supply of 200,000 doses which the government has procured is insufficient to cater to the demand, private clinics can bring in additional supply, as is the case for any other WHO EUL vaccine under the special access route. As of 9 July 2021, HSA has received 10 adverse event reports following vaccination with the Sinovac vaccine. The event comprises mainly allergic reactions such as itch and rashes. As for concessions on safe management measures, the data on the efficacy of the Sinovac vaccine against the Delta variant is still building up. Sinovac has also recently submitted the required safety data for their application for the pandemic special access route approval to HSA. So the HSA and our expert committee are going through the various data. When the evidence justifies it, we will certainly want to extend the concessions to individuals who have received the Sinovac or other vaccines which may qualify. Mr. Deputy Speaker, sir, let me conclude. As a government, we need to recognize that our society is diverse, with different segments of the population having different opinions, needs, and wants. When these differences cannot be reconciled, we agree to disagree, we live and let live. At the same time, we do our best to unite and forge a consensus for what is a society without commonalities and without shared commonalities. And this is what a responsible government needs to do across a range of issues, from education, healthcare, public housing to racial harmony and free trade. We must always try to strike a balance between forging a consensus as well as respecting diverse views. It is the same when it comes to learning to live with COVID-19. On the one hand, we have the young, vaccinated individuals who feel that we should open up and allow vaccinated individuals to enjoy more social activities. On the other hand, we still have a sizable segment of older Singaporeans who, for medical or other reasons, are yet to be vaccinated and who remain vulnerable. Differentiated safe management measures is something we will have to put in place for public health reasons and to protect the unvaccinated. But at the same time, we must do our best to get more of the vulnerable vaccinated just now. As I reported just now, we are making progress. As for the non-vulnerable, as more of you get vaccinated, when you show more consideration to others, you're also doing your part to better protect the vulnerable. Remember our children, our nieces and nephews, younger brothers and sisters, under 12, will not be vaccinated for a while yet. So when we work together as a people, we will bring ourselves to a much stronger and more resilient position, and our transition to living with COVID will gather pace. Mr. Deputy Speaker, sir, Singapore is one of the few countries to have come through the last 20 months of the pandemic with very few fatalities. And we can look forward with confidence to living with endemic COVID-19 because a high proportion of our population will be fully vaccinated. Most of the developing world still has little access to vaccines. And even amongst the countries and regions which have vaccines, Singapore is unique. Because we have one group, including US, UK, Israel, many EU countries, which went through major episodes of widespread transmission, hospitals overwhelmed with many fatalities. They are now highly vaccinated and opening up their economies and societies. And then there's another group, the likes of Australia, New Zealand, Hong Kong, maybe South Korea, who kept the pandemic under control, but are now finding it a challenge to get their people vaccinated, partly because their lives have not been very threatened by COVID-19. And this will make us perhaps the only country in the world which has not suffered a collapse of our hospitals, nor a high death toll, and at the same time achieve a very high vaccination rate in our population. And this uniqueness is due to the unity of our people, the trust amongst them, and between people and government. Mr. Deputy Speaker, sir, we can look towards the road ahead with confidence and optimism. Thank you.
The Minister for Trade and Industry and Minister for Finance will be making related ministerial statements. I will allow members to raise points of clarification on all three statements after the third statement. Minister Gan.
Thank you, Mr. Deputy Speaker. Minister Ong Ye Kung has given members an update on the COVID-19 situation. Let me now share with members our journey out of Phase 2 heightened alert and towards a COVID-resilient state from the point of view of businesses. About a month ago, the MTF co-chairs wrote a commentary outlining a future where Singapore can live normally with COVID-19. The virus is likely to become endemic eventually, like influenza, with the vast majority of us protected against the severe outcome of the virus, as long as we are fully vaccinated. We are not there yet, and we need to press on with vaccination, especially among the elderly. As we journey towards this destination, we were never under the illusion that it would be straightforward, and we expected to face a few bumps along the way. The KTV and Jurong Fishery Port clusters are cases in point. Like Minister Ong, I received many questions on whether our decision to return to Phase 2 heightened alert signals a reversal of our plan to transition to a COVID endemic state. The answer is a clear no. We are determined to get to our destination of being a COVID-resilient Singapore, but our journey must take into account public health realities. Sometimes we may need to take a detour if we see hazards ahead. This way, we can ensure that we will get to our final destination safely, even though it may take a little longer. The last 1.5 years has been a very difficult ride for our businesses. This is particularly so for sectors that are more affected by the tightening of safe management measures, such as F&B, retail, sports and gyms, and performance arts. I know that the impact on them must be very severe. Minister Wong and I met the F&B and Retailers Trade Associations last week. We appreciated their feedback, which helped MTI and MOF design the support packages for them, as well as for the other affected businesses. At the same time, I'm also heartened to see that many businesses have adapted their operations in response to the challenges. Food establishments and retail shops have leveraged online platforms, and gyms have turned to virtual classes or moved some of their classes outdoors. Nevertheless, we know that these efforts are insufficient to fully compensate for the loss of income from their usual business model. The aviation, tourism, and mines sectors have also been severely impacted due to travel restrictions, with Changi Airport's passenger load at only around 3% of pre-COVID levels. 3%, not 30%. 3% of pre-COVID levels. Demand in these sectors have plummeted. Some firms have pivoted to adjacent areas. For example, Singapore Airlines is now using some of its passenger planes to operate cargo flights to take advantage of the increase in cargo traffic, while operators in the tourism sector have come up with new and creative products to attract local visitors, as foreign tourists have dried up. The Singapore Rediscover vouchers would have helped them somewhat. The construction, marine, and process sectors are also under tremendous pressure. They have had to make difficult but necessary worksite adjustments to protect workers' health and safety. At the same time, they have had to deal with labor shortages. As a result, many have faced project cancellations and delays, or shied away from taking on new projects. We fully understand the challenges and uncertainties that our businesses and their workers are going through since the start of this pandemic. MTI has worked closely with industry and other government agencies to help businesses cope. We delivered 8 budgets over 1.5 years, including the supplementary supply bill that we will be debating later, to marshal resources to support businesses and protect jobs. We introduced several schemes, such as the Job Support Scheme, Jobs Growth Initiative, rental relief, and tax rebates. We ensured that firms that ran into cash flow problems could gain access to credit by enhancing our enterprise financing schemes and working with the banks to put in place a moratorium on loan repayment. Together, these efforts have helped avert massive business failures, a much deeper recession, and higher unemployment. Businesses and workers have told us that while these support measures have been critical and helpful, they can only serve as temporary pain relief. They would much prefer to resume their business fully and for the economy to grow again. Many are therefore transforming their businesses to seek out new opportunities and prepare for the recovery. I think this is the right attitude to have. Even as we manage the short-term impact of the pandemic, we should not lose sight of the future. COVID-19 has wreaked havoc on almost every single economy in the world. But those which can respond well and take the opportunity to adapt and transform quickly will emerge stronger and move ahead of others. To ensure that we do not get left behind once the dust settles, we must turn this once-in-a-generation crisis into a once-in-a-generation opportunity to transform our businesses, develop new areas of growth, and strengthen our connections to the global economy. We recognize that it is not easy for businesses to juggle everyday challenges during the pandemic and the need to change and transform for the future. We need focused efforts. This is why we set up the Emerging Stronger Task Force, or EST, at the height of the crisis in May last year, to look at how Singapore should refresh and reimagine our economic strategies going forward. The EST formed 9 Alliances for Action, or AFAs, as a new model of public-private partnership to allow our businesses to move quickly and bounce back stronger. Some of the AFAs have delivered promising results. For example, the AFA on safe and innovative visitor experiences enabled us to test-bed several ideas for safe MICE events, which provided some relief for the MICE sector while also elevating its international profile. The AFA on supply chain digitalization saw the growing demand for supply chain transparency and resilience and created SG TradeX, which stands for Singapore Trade Data Exchange. As a digital infrastructure, SG TradeX allows businesses to share data with each other in a trusted and safe manner, thereby allowing them to optimize their supply chain flows through Singapore. With more trades coming through Singapore, our position as a key node in the global supply chain is further strengthened. For sectors that are doing well despite the pandemic, the government's focus is to add wind to their sails, to help them create new products, forge new partnerships, and break into new markets. These include the financial, ICT, biomedical manufacturing, and the electronic sectors. In particular, the biomedical manufacturing sector expanded significantly by almost 25% last year, while the electronic sector grew around 12.5%. The AFA on medtech product development is another good example of our new partnerships. Recognizing the increasing prevalence of infectious and chronic diseases, it identified in vitro diagnostics as a key subsector that we can grow. We will continue to work closely with industry and partner businesses in this endeavor to give them the support they need to raise their productivity, innovate, and grow beyond our shores. We will also help workers to be ready for the challenges in the new normal. As businesses transform to remain competitive and seize new opportunities, workers will also need to learn new knowledge and acquire new skills. The need for workers to upgrade and upskill is more urgent than ever. The government is committed to walking this journey with our workers every step of the way. We introduced the Skills Future movement in 2015 and intensified our efforts through the SG United Jobs and Skills package since the pandemic started. We will work with the Ministry of Manpower and the unions to encourage and support workers to tap on these schemes to stay relevant in their current job or retrain to enter new jobs. I also call on employers to continue working with the government and the tripartite partners to upgrade and redesign jobs and invest in workforce training. Even as we plan ahead, we know that businesses are naturally concerned about what an endemic state means for their daily operations and the adjustments they may need to make as we get there. Let me sketch out the path forward and give businesses a sense of what to expect to help them plan ahead. Some of the details are still being finalized and we will share them in future. As our vaccination coverage increases, we will be in a much stronger position to ease our COVID-19 measures and safely and confidently. We will begin to adjust our safe management measures in stages while keeping an eye on the number of serious cases. For example, restrictions on social gatherings will ease, and we can expect larger dining in group sizes and lower requirements and higher capacity for various events. We will take a differentiated approach. Vaccinated individuals will be able to engage in a wider range of social activities and in larger groups, while those who are unvaccinated will only be able to do so with a negative pre-event test result. With this, F&B, retail, and other businesses that provide in-person services, such as gyms and beauty services, will see a return in demand. Sectors such as tourism, cruise, and MICE will also get some relief as capacity limits are progressively raised, although foreign tourists will still take some time to return. Workplace restrictions will also be eased, and progressively, more workers can go back to office. Businesses will be able to conduct important face-to-face meetings or hold workplace events that are important for networking or team bonding. Businesses can do several things to prepare for reopening. First, encourage and facilitate all medically eligible employees, especially those involved in high-touch point activities, to get vaccinated, and deploy those who cannot be vaccinated to lower risk settings. Second, integrate the use of ART self-tests into your work processes, especially for businesses that provide high-touch point services or which tap on a pool of workers that frequently change. Encourage employees to self-isolate and get themselves tested if they are not feeling well, or if they suspect that they may have been exposed to COVID-19. Doing so can help detect cases early and limit the extent of disruption to your businesses. I know of several employers who have made bulk purchases of testing kits so their staff can easily access them if needed. This is a good idea, and I encourage more employers to do so. And third, continue allowing flexible work arrangements and putting in place business continuity plans to strengthen operational resilience. We are also looking at relaxing our border restrictions safely. As a small and open economy, we simply do not have the luxury of closing ourselves off to the world. Many parts of our economy require a steady flow of people in and out of Singapore, be it workers or visitors. As a business hub, many of our executives have to travel to manage and grow their regional businesses. Our tourism and MICE industry, as well as our air hub status, also critically depend on international connectivity. We should also not forget the international community based here. Many have not been able to return home to visit their family since the start of the pandemic. And this is because if they go home, they may not be able to return to Singapore. There are also Singaporeans whose loved ones are stranded overseas. This has not been easy for many of them. Therefore, as our vaccination coverage increases and the majority of residents here are protected against COVID-19, we will also progressively facilitate international travel with countries that have managed COVID-19 well and allow fully vaccinated persons to travel and to do business more freely. This is a critical move that will allow us to reassert Singapore's position as a business, travel, and talent hub. We are working this out carefully and engaging our partner countries, and will provide more details when ready. We will continue to push for higher vaccination coverage, and if the incidence of severe illness from COVID-19 remains low, despite clusters emerging from time to time, we will eventually be able to arrive at a truly endemic state. Practically all social and workplace restrictions can be lifted, although some critical measures, such as mask wearing and precautions for large events, may remain. This means that domestically infected cases will create much less disruption than they do today, and our businesses can largely return to normal operations. For the majority of cases, businesses will not have to shut down their premises for deep cleaning, and we need not commit huge resources towards contact tracing. Instead, infected individuals with mild symptoms may be able to recover from home, and close contacts will likely just be required to monitor their health without the need for quarantine or self-isolation. This is similar to how we treat influenza cases today. Globally, Singapore will likely be one of the highest vaccinated countries in the world. We will be able to regain strong air and maritime connectivity to a large number of countries, while ensuring that our healthcare system is well-functioning and not overstretched by COVID-19 cases. This will make us one of the best places to work and live in the region and across the world. Businesses have in fact continued to show confidence in our strong fundamentals during the pandemic. Despite the challenging environment, investors committed $17.2 billion in investment in 2020, the highest in 12 years. More recently, we also attracted significant investment from major biomedical and electronics companies, such as Sanofi in April, BioNTech in May, and GlobalFoundries in June. But we cannot take this for granted. We will continue to work hard to pursue projects that help companies grow and create new jobs and meaningful careers for Singaporeans. Before I end, I would like to thank Singaporeans, our businesses, and our workers for walking this journey with us for the last 18 months. It has been tremendously difficult for many of you, and we are deeply appreciative of the commitment and grit you have shown. We are so close to reaching the end of the tunnel. We will soon achieve a high vaccination coverage, which will allow us to move decisively to a COVID-resilient state. I want to appeal to everyone to not lose heart and work together to press on in our journey. Thank you.
Minister Wong.
Mr. Deputy Speaker, sir, like many countries around the world, our fight against COVID-19 has been difficult and full of ups and downs. The latest outbreak is a major setback for all of us. Many have been surprised at the size of these new clusters. It shows how easy it is for the Delta variant to spread and cause large outbreaks with the potential to overwhelm our hospital system. Furthermore, in a mixed population of vaccinated and unvaccinated persons, we are more likely to see large clusters because vaccinated persons can be infected but experience very mild symptoms. Consequently, they may not realize they are infected and inadvertently become asymptomatic carriers. By the time the cases pop up, days or even weeks would have passed and the infection would have spread to many people. Because of these large clusters, we faced a heightened risk of widespread community transmission before we attained adequate vaccine protection. We must remember the proportion of people with 2 doses and with 2 weeks after their second shot is still less than 50%. This is when we moved into the heightened alert. And we are especially worried about our seniors, because there are still over 200,000 seniors above age 60 and above who are not fully vaccinated. If they catch the virus, many will likely become severely ill or even succumb to the infection. And that's why, as you heard just now from my co-chairs, the MTF made the difficult decision to scale back activities and return to phase 2 heightened alert. This will help to slow down transmission in the community, and crucially, this will give us time to push up vaccination rates further and protect our seniors. I know the restrictions have caused much inconvenience to everyone. We seek your forbearance and understanding. I hope our explanations will help you understand why we had to reintroduce these painful but necessary measures to protect our seniors. We also know these measures will be difficult for our workers and businesses, and that is why MOF announced a new $1.1 billion support package last Friday to cushion the impact. I will elaborate on this in my statement later this afternoon on the supplementary supply bill. and we hope the support measures will help affected workers and businesses tide over the heightened alert period. As we bring the current outbreak under control and continue to speed up vaccinations, we will be able to get our reopening plans back on track. The key is to open up at the correct juncture. Some countries have decided to open up fully even though their vaccination rates are less than ideal. For example, the Netherlands lifted all restrictions when 45% of its population was fully vaccinated. Cases surged tenfold to an average of 10,000 a day within 2 weeks. They have since reimposed restrictions. The UK has about 55% of its population fully vaccinated, although its coverage of its seniors is much higher at above 90%. It lifted all restrictions on 19th of July, its Freedom Day. Cases surged to 50,000 a day, more than 2/3 of its peak in the last wave, and are likely to rise further. Hospitalization and death rates are starting to creep up again, almost entirely amongst unvaccinated individuals. We are watching what's happening in these countries very closely. What is clear to the multi-ministry task force and our medical advisors is that we should be very careful about lifting restrictions when a significant proportion of our people are still not fully vaccinated, especially our more vulnerable seniors. While other countries may have come to terms with a certain level of COVID-19 cases and even deaths, this is not the choice we want to make in Singapore. Here, we look out for one another and we take care of each other. We do not want to see large numbers of COVID-19 patients in intensive care, on oxygen supplementation, let alone succumb to the virus. So we must give our fellow Singaporeans more time. Today, many younger Singaporeans are still waiting for their second doses of vaccines. And many of our seniors who had been hesitant about getting vaccinated are now starting to step forward. So we will see continued improvements in our vaccination rates. At the same time, there is no need to wait for everyone to be vaccinated before we begin to open up. That would mean holding back the entire reopening timeline until much later in the year, which is not tenable. So what is our approach? Let me explain. We will synchronize our reopening with our vaccination coverage, not just of the overall population, but also amongst our seniors who are the most vulnerable. And we will do so in a series of controlled steps. So this is what we can all expect in the weeks ahead. In early August, at the midpoint of the Phase 2 heightened alert period, we plan to review the current set of measures. We will assess the overall infection situation. We will also monitor the status of the infected cases to confirm that the link between infection and hospitalization has been weakened by the vaccines, like in the chart just now which Minister Ong showed. Importantly, by then, 2/3 of our population would have received 2 doses, and we would have vaccinated about 3/4 of our seniors aged 70 and above. So if the clusters are under control and hospitalization rates remain low, we will be able to ease some of the Phase 2 heightened alert measures. But the easing will be differentiated and extended to only vaccinated persons because they are much better protected against the effects of the virus. This means that if you want to attend a large event or a religious service involving more than 100 persons, you have to be fully vaccinated. If you want to go out to dine in a restaurant or work out in a gym, you have to be fully vaccinated. By around early September, we expect to vaccinate about 80% of our population with 2 doses, and we hope to cover a similar proportion of our seniors aged 70 and above. We will then be able to ease the restrictions further, including allowing larger groups to get together, especially if they are fully vaccinated. We will also begin to reopen our borders, especially for vaccinated persons to travel. We will start by establishing travel corridors with countries or regions that have managed COVID-19 well and where the infection is similarly under control. So fully vaccinated persons will then be able to travel to these countries or regions without needing to serve the full 14-day stay-home notice in a hotel when they return. Depending on the risk level of the country they visit, we will either replace the SHN with a rigorous testing regime or shorten the SHN to 7 days at home. And this will allow vaccinated persons to travel more freely. Those who are not vaccinated can still travel, but will be subject to the prevailing SHN requirements. Beyond that, we will continue with a series of progressive easings. As we do so, we must expect cases to rise, partly because there is still ongoing cryptic transmission in our community, which can easily break out into new clusters with increased activity levels. Also, as we open our borders for people to travel without SHN, we will see more imported cases and infected persons slipping through from time to time. But at that stage, as you heard just now, our main focus will no longer be on daily case numbers. Because the vast majority by then would have been vaccinated, and even if they catch the virus, they are much less likely to become very ill. Instead, our focus will be on the much smaller number of infected persons who need supplementary oxygen or require intensive care. So at each stage of easing, we will monitor the health outcomes, especially the hospitalization and ICU cases closely. We will ensure that these remain acceptable and stable before we proceed to the next step. But if hospitalization cases or worse, severe illnesses were to shoot up, we will have to be prepared to slow down or even pull back. In particular, we have to expect new variants to emerge, which may be more transmissible, more lethal, or more successful at evading the present vaccines. We will find solutions to these variants, especially through booster shots or updated vaccines, which we may need to roll out nationwide. But we must be prepared that the new variants can lead to more severe outbreaks and may well force us to introduce restrictions again from time to time. In short, there are still considerable uncertainties about how the pandemic will unfold globally. But our best bet is to push ahead with a high level of vaccine coverage for our people. This will give us the best chance to resume more normal lives while keeping our morbidity and mortality rates low. I've provided an overview of the roadmap for our transition to a COVID-resilient society, where we learn to live with COVID-19 as part of our daily lives. The MTF is still fleshing out the details, and we will share more when ready. I assure everyone that we are committed to seeing through these plans. The current heightened alert is a temporary, limited timeout. With better vaccination coverage, we will soon be able to resume our plans to reopen progressively while keeping everyone safe. But I underline, vaccination is key, especially vaccination for our seniors. If many among our seniors are not vaccinated, we will continue to worry about our hospitalization and ICU cases, as well as fatalities. So I make a special plea to all who remain unvaccinated or have not registered to be vaccinated, especially our parents and grandparents. Please come forward. And if you can't get out of the house, we will send a team to your homes for the vaccination. As part of our controlled and phased reopening, safe management measures will still remain relevant and important. Basic SMMs like keeping a safe distance from others and wearing a mask can help reduce transmission effectively. So we must stay disciplined and continue to maintain these practices even as we transition towards the new normal. For example, we would probably not want to do away completely with our mask requirements. We may consider dispensing with masks when outdoors, but it would still make sense to wear them in an indoor, enclosed environment where transmission risks are greater. So this may well be one of the last rules to go in the new normal. At the same time, we will continue with our regular enforcement checks and take strict actions against any breaches of the rules. Several members have asked questions about this, especially how our nightlife establishments are monitored. And I believe Minister Shanmugam will be sharing more on this, especially efforts by MHA and the police later too. But let me just say that our enforcement agencies are doing everything they can in very challenging circumstances. Since April last year, a multi-agency task force comprising various government agencies, including the police, have been coordinating the enforcement of safe management and safe distancing measures in public venues, including F&B outlets and massage and spa establishments. They have been doing daily enforcement checks, where laws were flouted, offenders, both operators and individuals, have been taken to task and cases publicized. Our SDAs and enforcement officers will continue to do their best, and we should give them our full support. Most importantly, we must all do our part and continue to exercise individual and social responsibility. We cannot rely on enforcement efforts alone to get us through this pandemic. Our society will be much safer if we demonstrate social solidarity and a collective sense of responsibility to do the right things together. There are a few simple but very effective precautions which we should all incorporate into our daily routines. And we've said this probably like 1,000,000 times, but I think it's worth repeating. Practice good hygiene. If you're not feeling well, stay home. See a doctor and get yourself tested. Do so even if you are vaccinated. Remember what I said earlier at the start, that vaccinated persons can get infected and may feel very mild symptoms or even no symptoms. So even if you're feeling unwell, vaccinated, feeling unwell but very mild symptoms, get yourself tested. If you receive an SMS alert, come forward to be tested as soon as possible and minimize your social interactions until you have a confirmed negative test result. There is really no excuse not to be tested, since testing is now more affordable, accessible, and convenient than it used to be, and will continue to be so in the future. The antigen rapid test kits, the self-test kits are widely available at all general retailers now. If you buy in bulk, it's cheaper too, so you can buy a few and have it at home. The MTF is also distributing these test kits to households. We are starting with those who live near markets where large clusters have been identified, and we will progressively scale up and distribute to everyone in Singapore. And as you heard just now, we are also rolling out new methods of testing, be it wastewater surveillance in our estates or breathalyzer test at our checkpoints. And now we have the breathalyzer test in Parliament too before each parliamentary session. So regular testing and the social consciousness to get ourselves tested regularly will protect us and keep us safe as we transit to the new normal. Mr. Deputy Speaker, sir, we are all disheartened and upset when we hear of people breaking the rules, acting irresponsibly, and causing new classes to break out. But over the past year and a half, the vast majority of Singaporeans have shown tremendous discipline. Many have also been working tirelessly in our fight against COVID-19. It's not just our healthcare workers like our doctors and nurses at our hospitals, clinics, and community care facilities. It's also our fellow Singaporeans on the front lines elsewhere, some in less expected settings, others in less visible places. They include our safe distancing ambassadors, food delivery riders, cleaners, and many more. They work hard to keep Singapore going and to keep all of us safe. Like Mr. Lok Chun Kiet, a cleaner with CBM Private Limited. He attends to high-risk locations where positive cases have been detected. The cleaning work that he does is not easy under normal circumstances. But now, with the exposure to the virus, he and his team have to put on full PPE and adhere closely to stringent procedures while they work. It's because of people like Chun Kiet and his team that we are able to quickly deep clean our infected premises and minimize the risk of fomite transmission. Or Ms. Siti Zulaina binti Muhammad Said, a senior medical technologist with the National Public Health Laboratory at the NCID. She leads the team to investigate outbreaks and undertake testing surveillance. It's mission-critical work that requires long hours, stretching into weekends and public holidays. You can imagine the load coming through recently with the surge of cases we've had in the community. It's because of people like Siti and her team that we are able to detect and ring-fence infections early. There are many more Chun Kiets and Sitis out there, many more unsung heroes and heroines quietly and steadfastly contributing to our fight against COVID-19. I'm sure the entire House will join me in saying to all of them a big, heartfelt thank you. Sir, these actions of our fellow Singaporeans inspire us and give us confidence and hope that we will get through this together. We are all disappointed by the latest outbreak and the heightened alert restrictions, but we will recover and bounce back. It's always darkest before the dawn, so let's be strong and keep the faith. The dawn is coming. Let's approach it with renewed strength as one people. Thank you, Mr. Deputy Speaker, sir.
Minister K. Shanmugam.
Thank you, Mr. Deputy Speaker. I would like to address some of the questions that have been raised in relation to enforcement against KTV outlets specifically. In this House and outside, there have been a number of questions related to KTVs. KTVs and nightclubs allowed to operate as F&B outlets. The enforcement regime in respect of these outlets, why were hostesses allowed in those places, and the immigration status of those providing hostessing service at these places. For example, I can refer to a Facebook post by Mr. Alan John, former editor of Straits Times, raising some of these questions in a very succinct way and making a number of fair points based on his understanding of the facts. And I'll address these questions. First, why were KTVs allowed to change into F&B operations? During the circuit breaker last year, nightlife outlets were shut from 27th of March 2020, together with many other businesses. From phase 2, which June 2020, many businesses were allowed to reopen, including dine-in at F&B outlets. Massage establishments were also allowed to open with conditions, but KTVs were not allowed to reopen. We took a stricter approach with KTVs because singing was considered a high-risk activity in an indoor setting and a higher risk of transmission. In August of 2020, the Singapore Nightlife Business Association, called them SNBA, and the Singapore Entertainment Affiliation, SEA, other associations, as well as individual businesses, appealed for KTVs to reopen. They had been closed by then for several months. Jobs, livelihoods of those in the KTV industries, the workers, their jobs were at risk, badly affected, even with financial support from the government. Our assessment is that they probably employed about 10,000 local workers as of end 2019. Some of us met directly with the KTV businesses in August of 2020, listened to them. There were several town hall sessions. They asked to have singing, dancing to resume, and they proposed a pilot with a maximum of 5 persons in a room. Masks would be worn when not singing, and disposable microphone covers would be used. And they referred to other countries, including South Korea, where this had been allowed. Others proposed changing their business models to F&B outlets. They needed help to get new permits, change their use for F&B and so on. And for many, the situation was desperate. We considered their suggestions, weighed the risks. At one time, we considered possibly allowing a pilot project for KTVs with very strict conditions, but eventually we didn't proceed. So the first point to note is from March of 2020 until now, KTV operations remain forbidden. It's illegal to have any kind of KTV operations. Right? We didn't allow those. Then the group that had asked to move over to provide F&B on a temporary basis, we said okay to that, again with several conditions. Why? Because basically anyone can offer and open an F&B outlet. And the government can't specifically say no to KTV outlets which want to become F&B outlets, provided they have the space to be an F&B, premises allow F&B outlets, and can get approval from SFA, land use permissions, and so on. And conditions were imposed. The pivoted businesses would need a food preparation area to prepare and serve food, adequate indoor dining area for customers to be seated to have their meals, with safe distancing in place. And once converted to F&B, they were subject to the same safe management measures, SMMs, imposed on F&B outlets, meaning no intermingling amongst patrons and staff, no live music, no performances, various other conditions. So in summary, since from March 2020 until now, 1, KTVs were not allowed to operate, and 2, some KTVs were allowed to become F&B outlets, as well as some pubs and bars, which they were also allowed to pivot to F&B outlets. So if you look at, as of March of this year, after several months of operations of these massage establishments, former pubs, bars, KTV businesses pivoting to being F&B outlets and so on, situation was stable, numbers of cases, infections was generally low. So that's the context and the background to why pubs, bars, KTV outlets were allowed to pivot and provide F&B. 2, it has been suggested that we should have assumed or known that KTV operators will cheat, allow themselves to become semi-brothels, even though they were only allowed to provide F&B. And there have been suggestions ranging from we were in effect in cahoots with KTVs, which is a suggestion in a recent, quite unbalanced Nikkei article. Or alternatively, we were very naive not to realize what happens in KTVs. The truth is we were neither in cahoots with the KTV operators, nor are we as naive as some suggest. Let me explain. I think most people will accept it'll be wrong to treat all the 430-odd businesses, KTV operators, pubs, bars, who want to change to provide F&B automatically as crooks. Right? Several are genuine operators. They want to pivot over to provide F&B. That is the only way they can survive. If you ask SNBA, SEA, there are KTVs which cater to families. There are many which do legitimate business, and they were crying out for help. So more than 400 such businesses converted, and about 100 exited the nightlife industry. At the same time, as we were considering this, yes, MTF, government, does know that there are some KTV operations, pubs, bars with dodgy reputations. Should we have said to them, no, you cannot convert to F&B? And for some, if you look at their premises, darkened rooms, not the most optimal for dining, and people might well say, why would I want to go here for dining? It appears commonsensical to say this is dodgy and doubtful, but in law, it's not so straightforward. If the person comes to you and says, yes, I want to convert and I will keep to the rules, this is how my business was perfectly legal in the past, and now I will continue to be legal, then the agencies will have to look him in the eye and say, you can't get a license to become a food place because we don't think you are going to keep to the law in future. We think you're going to break the law. even though you have committed no offense, and even though you confirm that you will follow the rules. So I'll come back to this later. So in addition to seeing if we can say no to those with dodgy reputations, part of the answer has got to be enforcement. And I will also say realistically, the people who are going to cheat, going to do illegal things, will do them anyway. They will use lounges, flats, warehouses, various places. It has gone on, and I'm sure it goes on, regardless of whether we allow the change to F&B. And there have been several illegal operations in different places outside of KTV outlets or ex-KTV outlets, which have been busted. So as of November 2020, it was a risk-assessed approach, and in general, it was working if you look at it as of March this year, with a relatively low number of cases. We then had the Delta variant, completely different transmissibility. That variant came into the KTVs, created a cluster. There is some public confusion. Minister for Health, my colleague, has spoken about it a number of times to clarify it. The confusion that the KTV cluster was somehow the reason for the recent phase 2 heightened alert, tightened restrictions imposed on 22nd of July. That is not so. He has clarified it. That's not so. If we had only the KTV cluster, then we would not have had to move to phase 2 HA or the tightened restrictions. In fact, the MTF, as he pointed out, considered the KTV cluster and decided we can manage it without having to impose any additional restrictions. And as he said in his speech, the KTV cluster has been brought under control fairly quickly, tracing, testing, ring fencing the cases. So we have about 5 new cases linked to the KTV cluster each day for the past few days. He gave you the figures. I have the figures as of 24th of July, 232 cases, 49 in hospital, none have been or are in ICU. So let me summarize by making 3 points. About 430 businesses pivoted to F&B for several months. Cases, infections overall in Singapore were low. The new Delta variant caused a KTV cluster that has been brought under control. And 3, if we were facing only the KTV cluster, there would have been no need for any tightened measures. Tightening of the measures is due to the cluster at the Jurong fishery port. It has spread from the ports to the markets and the hawkers and into the wider community. My colleagues have explained how this happened. Some are under the misimpression that the virus went from the KTVs to the fisheries port. The evidence we have doesn't suggest that. The virus seems to have come from the region to our port, JFP. Now, with this background, there is a live issue which I will share with members. The SNBA has sent an open letter, appealed for the industry to work more closely with the government to report illegal activities, among other things. And they have also pointed out pivoting has helped many legitimate businesses to survive. So should we allow them to reopen and continue as F&B operations? This brings me to the earlier question I posed. Some of them, when you look at the premises, you do question if they can really be F&B, but it requires us to say flat out to the operators, regardless of what you say, I'm not going to believe you, and I'm not going to allow you to operate an F&B. Agencies are working on the conditions that can be imposed, like CCTVs, various other conditions, over and above what's applied to F&B outlets. They will also have to consult with the AGC. Can we say no to an operator if we think it might be dodgy, even if the operators undertake to comply with the conditions? It's not so straightforward. Once these issues are assessed, MTF has to decide on whether the opening or reopening can be allowed. I will now deal with the questions which have been raised on enforcement. The period October 2020 to 10th of July 2021, the police conducted 202 operations against pivoted outlets, as well as other outlets which were operating illegally. So this is what I said earlier. Assume we had said no to all pivoting of F&B operations, there would still be places which offer sex and meetup opportunities. That was always going to happen. So we had one police operation every single day on average since October 2020. So this, I think, should put to rest any questions about enforcement actions by the police. One operation every day. And that has resulted in the detection of 58 Public Entertainment Act, Liquor Control Act infringements, 595 SMM breaches, 142 arrests for offenses under various laws, including the Public Entertainment Act, Liquor Control Act, Employment of Foreign Manpower Act, Immigration Act, not all in pivoted places, but also in completely illegal operations. To share a few examples, in October of 2020, police raided units along Ubi Road and Kalang Pudding Road. 57 persons were investigated for breach of SMMs. In November at Genting Lane, 24 persons were investigated for breach of SMMs. 10 women were arrested for work pass-related offenses. In February 2021, at Emerald Hill Road and again at Genting Lane, 88 persons investigated for breach of SMMs. 1 man arrested for working without a valid work permit. In April at Kitchener Road and Verdun Road, 45 persons investigated for breach of SMMs, 7 men and 1 woman arrested. In all the cases, items such as karaoke equipment, liquor were seized. Operators are being investigated. Enforcement operations were also conducted over 20 weekends at every single festive occasion since October of 2020. About 400 F&B outlets, including pivoted outlets, were inspected in each operation. To date, agencies have imposed around 100 closure orders on F&B outlets, including on about 40 pivoted outlets. As I said to the House just now, there were about 437 pivoted outlets, so roughly 10% have been acting illegally, and about 60 other F&B outlets also were in breach. So SFA has permanently revoked the food license of 7 pivoted outlets as of 23rd of July. So let me now move to this business of hostesses. Since the onset of COVID-19, the rules are that hostessing is not allowed in any setting. The women who were caught were likely in breach of their visit or work pass conditions, and they were operating illegally. And the first woman, much attention has centered on her, linked to the KTV cluster, had come into Singapore in February of 2021 through the boyfriend-girlfriend category under the what we call a familial ties lane. I'll refer to it as FTL, sponsored by a Singapore citizen who applied for her on the basis that he was her boyfriend. And let me explain this boyfriend-girlfriend category. At the start of COVID-19 last year, we banned short-term visitors from coming into Singapore. So as of September last year, the ban on short-term visitors continued. Basically, only Singapore residents can come back, some of their relatives, and some business travelers. In October last year, we introduced flexibility to allow boyfriends and girlfriends to come into Singapore. And why? We had almost a complete ban on short-term visitors, so boyfriends, girlfriends could not come in. There were many appeals. And for background reference, in the 10 years between 2000 to 2019, there were about 120,000 Singapore citizens who married who were in non-resident marriages. About 1 in 4 marriages were between Singaporeans and non-Singaporean partners. So it's quite common for Singaporeans to have relationships with non-Singaporeans. This boyfriend-girlfriend category was specifically introduced in the context of the ban on short-term visitors to allow Singaporeans who were in relationships with foreign partners to be reunited because they had been separated for a long time due to border restrictions. And this was after numerous appeals on this were received. Meanwhile, there was a parallel development around September, October 2020. we announced the unilateral opening to specific countries and regions which were of lower COVID risk, including Vietnam, Brunei, New Zealand, Australia, except Victoria State. Our assessment was the risk of importation of the virus was assessed to be low. Vietnam specifically had a comprehensive public health surveillance system, had displayed successful control over COVID at that time, and in the last 4 weeks of September 2020, it had 0 local COVID cases. So under the unilateral opening, travelers could seek entry into Singapore by applying for an air travel pass, and this means short-term travelers from these countries who are allowed to come in. In February 2021, due to the worsening COVID situation in Vietnam, we suspended the unilateral opening between Singapore and Vietnam, which meant that short-term travelers from Vietnam could not come in from February 2021 under the unilateral opening. ICA then began to receive many applications for Vietnamese to come into Singapore under the boyfriend-girlfriend category. And people are quite No, I wasn't going to say skeptical. I was going to say inventive. So to emphasize, once we suspended the unilateral opening with Vietnam in February of 2021, there were many applications under the boyfriend-girlfriend category. We looked at it, scratched our heads. The applications raised concerns because, I just give examples, several examples. There will be one Vietnamese applicant and multiple sponsors claiming to be the lady's boyfriend. There will be Singaporean sponsors, many who applied for multiple girlfriends. It's possible, but sponsors who are already married to someone else applying, many men claiming to be a single lady's boyfriend, I mentioned it earlier, and sponsors who are unable to substantiate when we ask questions, what relationship do you really have with this person who is proposed to become sponsored? But as members of parliament will know, the residents will come to the MPs and say, I'm a Singapore citizen, I've done national service, why are you not allowing my girlfriend to come in? We all have received such appeals, ICA received. But when we looked at these applications for girlfriends, and they were all primarily girlfriends to come in, we decided this won't do. We have to stop this. So in March of 2021, this girlfriend-boyfriend category was removed. So you can no longer appeal for a boyfriend or girlfriend to come in. So ICA moved quite fast, right? February, the unilateral opening with Vietnam was suspended. The next month, in March, the boyfriend-girlfriend category was scrapped because we took the view that this was being abused. So we created this category, boyfriend-girlfriend, during a pandemic last year, October, because we wanted to be compassionate. Now, if you wanted to rank the organizations in terms of compassion, I don't think most people will put ICA at number 1 on the list. But, and MHA will not usually be accused of being the most compassionate either. But we did want to try and be compassionate and helpful because of the number of appeals. And people want their loved ones to come in, and we want to try and help. But if the system is abused, then we have to stop it. If it's mutated, we have to stop it. But unfortunately, what that has meant is that many legitimate applications are now being refused. ICA has also taken action against, in respect of dodgy applications by rescinding the approvals, barring the travelers from entry into Singapore, and suspending the sponsors and travelers from future applications. Apart from the FTL category, we have other avenues for foreigners to enter into Singapore during this pandemic, but very limited. They include MOMs, a work pass holder lane, and MOEs, a student pass holder lane, where applicants are required to submit their application to MOM and MOE respectively for entry approval and are subject to screening, obviously. There are also short-term visitors who are already in Singapore before the border controls were imposed in March of 2020. And for these persons, ICA assesses their application for extensions of their short-term visit pass on a case-by-case basis It takes into consideration factors including restrictions on international travel, flight availability, and whether the applicants have family ties in Singapore. So, tying that back to the police operations against nightlife outlets, recent operations, 29 women aged between 20 and 47 of various nationalities have been arrested for offenses under the Employment of Foreign Manpower Act and other laws. The 29 include permanent residents, work pass holders, S-pass holders, short-term pass holders, 1 who came in under the unilateral opening, 5 who had come in under the girlfriend category, long-term visit pass holders, other passes, student pass, dependents pass. Permanent residents unlikely to have committed any offense except for maybe safe distancing measures. Others on work pass would be in breach of their work pass conditions if they were performing services as hostess, but those on visit passes would be in breach as well by working without a work permit. But if they say they weren't working, then we have to show that they were in breach. And it's often cat and mouse, and as members will know, we can't use trace together data for this. So far, 16 women have had their passes cancelled, and they have been or will be deported. Investigations are ongoing in respect of the other women. And of course, the operations, some of them are pivoted outlets, several of them are not, in other places, in warehouses, and so on. And we continuously have to look for them, rely on tip-offs as well as our own intelligence, and keep trying to keep it under control. So I think I've dealt with many of the questions that have been raised. Thank you.
Mr. Pritam Singh.
Thank you, Mr. Deputy Speaker. I have a few questions for Minister MTI, Mr. Gan Kim Yong, and originally Minister of Health, but I think I'll direct them to the Minister of Home Affairs. The first series of questions pertain to the differentiated regime between vaccinated and unvaccinated individuals, which is part of the coming to terms with the endemic state of treating COVID-19 as endemic in the community. This refers, the query pertains to the negative pre-event tests that unvaccinated individuals will be required to undertake. I think a few days ago in Israel, the Prime Minister announced that the unvaccinated individual there will pay for the test. I don't believe Minister clarified who pays for that test in Singapore, so it'll be helpful for Minister to clarify that. The second question directed at Minister Gan pertains to supply issues of the vaccine. I think previously in updates that the MTF had given, is this still a problem, or are we on track to open the economy in concert with the plan the MTF has announced by, I believe, September now? The question specifically on the KTV issues, indeed, as Minister Ong mentioned earlier, lots of disappointment among Singaporeans, but I thought it would be important to have at least some understanding of common facts before coming to conclusions. So the first question is with regard to the enforcement regime at the pivoted establishments. Was it a heightened sort of enforcement regime? Minister mentioned a few numbers, 202 enforcements from October last year to July this year, but was there some specific attention paid on pivoted KTV establishments? I think earlier on, Minister Wong spoke in a Facebook post about a cat and mouse game. Minister referred to that as well. Was there were additional conditions imposed on certain operators in view of their past record or reputation, so to speak? And in this regard, again, was there a differentiated regime from the enforcement agencies to pay more attention to some of these establishments? Minister spoke of some, I think a total of 7 establishments, and I stand corrected if I'm wrong, 7 establishments that have seen their licenses revoked, but that about 10% of the establishment, of the pivoted KTV establishments have been in breach of regulations. So are those, or are the licenses for those, for that 10%, which I think would extend to about 40 establishments, are going to be revoked as well? And finally, I received some emails from members of the public about warnings that they had given the authorities about some of these KTV establishments. How many warnings or feedback how many pieces of feedback did not just MHA but also MOH and the other agencies receive on potential SMM violations, egregious SMM violations in KTV establishments? Thank you.
Minister Gan.
Thank you, Mr. Deputy Speaker. Let me first address the question on the economic reopening. It is still on track, and the key is to look at the progress in our vaccination program. And our vaccination program, as Minister for Health explained just now, is picking up momentum. But it is important for us to focus a lot more on the vaccination of our senior population, which is of a greater concern to all of us. And therefore, I think we continue to be on track with our economic opening. And as soon as we are able to reach our vaccination rate of 80% and above, around about September or October, I think we will be able to move in a bigger way in the opening of the economy. But I will also want to point out that we are not likely to have a big bang opening to allow everything to be done in one go, because it is important for us, as Minister Ong and I mentioned earlier, to continue to monitor the impact on severe cases. Because if we do have serious cases, we will then have a problem with the capacity of a healthcare system, which will then result in a high mortality rate. So we need to continue to keep an eye on our number of serious cases, look at the trend of these serious cases, at the same time making sure that our vaccination rate is high. Then we will be able to progressively, step by step, open up our economy and open up our borders to allow travel in and out of Singapore. And as I mentioned in my speech, these details are still being worked out, and we'll share more details later on. I'll ask Mr. Wong to talk about testing, because this relates to the national policy on testing.
Thank you. The question, I believe, was about who pays for the cost of tests if the person is unvaccinated to get into a venue. Well, the rule will be, the thinking is that the rule is for certain activities, certain settings, we will require vaccinated persons only. And from the government side, the rule will be that if the person is not vaccinated, not fully vaccinated, then he will have to produce a negative test, a confirmed negative test. That is the requirement. Now, how to go about that? We will let venue operators and owners decide. They may want to do it free. They may want to set up an operation. A restaurant might want to do that. A venue operator might want to do that. A MICE event organizer might want to do that, because he says, look, I want to allow, do that to let unvaccinated persons come in. If not, then he may well say, look, it's up to the individual. The individual has to go to the clinic, get a test, and then show me the results. So the government sets a rule, the framework. I think individual organizations that then are looking at the framework can decide whether or not they want to provide the test for their customers, or they would require the customers to get the test from a clinic.
Minister Shanmugam.
Thank you. As I noted it, I think there were 4 questions, if I got it right, from Mr. Singh. First, on the enforcement regime, I think Mr. Singh wanted to know if it's heightened. I think Mr. can assume that if there was one enforcement action per day, it's quite intense, and it's been so from October of last year to July of this year, right from the beginning. And this is quite apart from what safe distance ambassadors and so on do. Second, I think Mr. Singh wanted to know, was there a particular focus on pivoted outlets? I gave the breakdown just now. Not all were targeted pivoted outlets. In fact, there were a number who were not to be operating at all. And in fact, totally illegal operations. And I would say, in terms of seriousness, those are particularly pernicious in terms of transmission, the kind of activities and so on. I mean, nothing is supposed to be happening in a warehouse. They set up and they do everything. And so those kinds of operations were busted as well. So a broad range, and also F&B operations which are not pivoted operations, just simply reopening. There are also some of them have been breaching. Now, don't mistake me to think that every single one was therefore engaging in what we might consider to be shadier activities. Sometimes they were breaches also, but we needed to target a broad range. Third, I think Mr. Singh wanted to know 7 have been closed, but 10%, I pointed out that 10% were in breach, about 40 odd out of the 400 odd which had pivoted. And are they going to be closed? I assume Mr. Singh is not asking for closing down every operation as long as there's any breach. There is a framework. Depending on the nature of the breach, there will be a penalty, and the penalty is transparent, and penalty will be imposed according to the kind of breach that has been committed. And I think most people will know there is also a point system for breaches, which leads to closure. Of course, egregious breaches, there will be closure. But, and I wouldn't ascribe to Mr. Singh the suggestion that police now should get even tougher and just close everyone down as long as there is one breach, right? Now, the last point, I think, was whether warnings given by public were taken seriously. Now, I don't do the operations, obviously, but I think most MPs will know how, in general, police intel system is expected to work. Police have their own intelligence framework, their own ground framework, and public tip-offs. A lot of crimes are solved by public tip-offs, and they are important. They're taken seriously, and I assume that goes into the assessment framework on what operations to conduct. Thank you, sir.
Minister Ong.
Thank you. There's a last question by Mr. Singh on supplies. Supplies continue to be in shortage throughout the world. Many developing countries are still trying to secure supplies. And in the earlier stage of the pandemic, we too are short of supplies. But fortunately, we had negotiated for APAs, advanced purchasing agreements, with major suppliers in the early stage of the pandemic. And lately, we were able to discuss and able to bring forward and confirm some of the delivery schedule. So as of now, for the past month or two, actually we have not had a supply problem. Our constraint now is we need more, especially our seniors, to come forward and get vaccinated.
Minister Gan, you have a clarification.
Thank you, Mr. Deputy Speaker. I just wanted to add a point to what Mr. Wong has explained on the testing strategy, because as time goes on, the testing system will also evolve. Say, for example, in time to come, if you have gotten a negative test result, you may be able to enter multiple events and multiple premises. So it's not just one event to one test. So you just have to bear that in mind.
Ms. Nadia Samdin.
Thank you, Deputy Speaker, and thank you to the ministers for the update. I have two groups of clarification points. The first is really stemming from a worry about discrimination on treatment between those who have been vaccinated versus those who are unable to, and those who do not wish to be vaccinated, and the treatment that they receive. On one hand, I empathize and hear the calls of those saying, what is the point of being vaccinated if I'm still, faced with certain restrictions? Or why are we being penalized? But at the same time, I know full well the impact of some of those who are unvaccinated for various medical reasons, in particular our seniors, and the social impact of the isolation, not being able to be involved in activities. As such, I wonder if in the Trace Together app, for example, we might consider amending it to show those who are vaccinated, those who aren't vaccinated, and those who cannot be vaccinated for medical reasons, and if there can be differentiation of treatment, if so, how? And also how this might take into account, for example, families who have seniors who are or children who are unable to be vaccinated. Moving on to my second group of clarification points, I think we have spoken about the KTV cluster, but I also like to ask about the Jurong Fishery Port cluster, as this spread has impacted stallholders, workers, and residents alike in both Mai Cheng San and Chong Boon markets, as well as food centres. Firstly, with the closure of Jurong Fishery Port and seafood stalls in the markets, what is the impact to the supply of our seafood, and what are measures which have been taken to mitigate disruption to these supplies? Second, some are also very worried about the safety of eating seafood during this time. Could the Minister please elaborate what led to the spread of COVID-19 in the Jurong Fishery Port, whether there are clearer findings on the mechanism of transmission of COVID-19 into the port and subsequently into our local markets, and whether our seafood is safe for consumption? And finally, as we look towards reopening, while we understand that there have been efforts to make the operations at the port contactless, we also understand that it's hard work, and working in the markets can be strenuous, and there are inevitably close interactions between the workers. Do our SMM measures need changing? And how can we ensure the safe reopening of Jurong Fishery Port and our markets and hawker centres? Thank you.
Minister Ong.
Thank you. I'll provide some answers, then I'll invite Minister Grace Fu to supplement with her clarifications. First, on the differentiation, I wouldn't call it discrimination, because there are good public health reasons to differentiate the treatment between those who are vaccinated and not vaccinated, because the differentiation helps protect those who are not vaccinated. Member asked about whether Trace Together app can indicate vaccination status. I believe it already does. Mine does. It says I'm vaccinated. You can check yours. Yeah, it does. Huh? Second is children or seniors who, because of medical conditions, are not allowed to be vaccinated, whether they get left out. Earlier on, when we came out with the 2-5 rules, one of the criticisms is that it's so confusing. And indeed, one of the confusion arises because of the exemptions we are trying to give. That in a group of 5, all vaccinated, but you're allowed up to 2 children below 12 who can't get vaccinated, but can join part of the group. Yeah. So I think when we do our midterm review, we will also take into account these provisions. And as for those who can't be vaccinated or unvaccinated for some reasons, but want to join such a group, we had earlier also allowed them to take a PET, a pre-event test, and if you are negative, you can join the group. And this is something we will consider as we do our midterm review. Lastly, I do want to reiterate a point I made earlier. When we get to a very high level of vaccination rate, there should be very little differentiation between vaccinated and unvaccinated, because collectively we will be very resilient. By then there will probably be justification for lesser differentiation. As for the point about seafood being safe, seafood is absolutely safe to consume. How did it get into the Jurong Fishery Port? as I mentioned earlier, phylogenetic studies show that there is likely to be multiple points of entries because there are slight genetic differences in the virus and in the infections across the cluster. We'll continue to see if we can trace the sources of the infections, but as of now, it doesn't help our public health measures. It doesn't help us to suppress the cluster. It helps us understand the infections, infiltration, how it happened, and help us strengthen the safe distancing, safe management measures. But as to controlling the cluster now, those information doesn't help, but we'll continue to study them.
Minister Grace Fu.
Thank you, Deputy Speaker, for allowing me to address the clarifications that Ms. Nadia Samdin has sought. Because I think of the important effect that the cluster has on this topic, I think it's important for us to give the House an account on Jurong Fishery Port as well as our food supply and its impact on hawker centres and markets. So with your permission, Deputy Speaker, may I address some of the PQs that members have filed on related subject as well?
Yes, please.
Members, Mr. Dennis Tan and Ms. Nadia Samdin have filed PQs on the same subject, set down for a later sitting. Several members have also filed related PQs for later sitting, which I will address together. So members Ip Hong Wing, Mr. Dennis Tan, on measures taken to mitigate the transmission of COVID-19 at our fishery ports and key food facilities. Mr. Dennis Tan on assistance given to the companies and workers at JFP. Mr. Darrell David on support given to stallholders and markets and hawker centres. Mr. Deputy Speaker, on food resilience, we have worked closely with industry partners over the years to build diversified food supply chains. This includes our seafood supplies. The Jurong Fishery Port handles about 30% of our total seafood imports and is complemented by Senoko Fishery Port, or SFP, which handles about 4% of seafood imports. The remaining 2/3 of our seafood imports are distributed to the industry via other routes. So it's a very diversified distribution platforms. Our seafood supply has remained stable despite the closure of JFP and local disruptions at our markets. Following the closure of JFP on 17 July, Singaporeans were understandably worried. Some had rushed to buy seafood over that weekend. We saw an increase in footfall at supermarkets after the market's seafood stallholders were required to get tested on 18 July. They could open their stores only after receiving a negative PCR swab test result. All JFP workers were quarantined, thus affecting the operations of many suppliers. The Phase 2 heightened alert restrictions on dining in moderated the demand. The Singapore Food Agency, SFA, and Enterprise Singapore, ESG, responded quickly to facilitate distributors and supermarkets to activate alternative arrangements. And these arrangements include diverting supplies directly to the supermarkets' distribution centres and retail outlets. Supermarkets themselves increased their stock of fresh produce through their suppliers. They have been keeping their retail shelves well stocked with a variety of seafood, including the frozen seafood varieties. Meanwhile, SFP Senoko remains in operation. As the market seafood stores resumed operations, some switched to SFP for their supply or sourced from alternative suppliers. We have sufficient stocks of frozen seafood. I visited the Jurong Coast store last Wednesday, which stores supplies of frozen shrimp, sea bass, and grouper, among others. The cold store facility serves many wholesalers, supplying to the supermarkets and food establishments island-wide. At the same time, retail food establishments are adjusting by switching to frozen alternatives. Our local farms also produce a good variety of seafood such as sea bass, tilapia, and grouper, and some of them have reported manifold increase in inquiry and orders. And they can be found online, for example, Lazada's Red Mart's Fair Price online shop, and at and at the supermarkets as well, such as Prime and Fair Price. And encourage Singaporeans to broaden their choices of seafood and where they buy their seafood from. We have been reviewing longer-term plans for this sector. Since 2020, SFA has been conducting studies on enhancement to the wholesale fresh produce sector and is working with NEA to study the wet market sector to better meet the future demands of consumers and industry. We will factor in lessons learned from this episode to better future-proof the sector. This episode has truly tested the resilience of our supply chains. Our overall seafood supply situation has remained stable because of our diversified supply and distribution channels. SFA and ESG will work with industry partners to strengthen their business continuity plans. And I'd also like to thank all the industry players for stepping up in this period of crisis. Next, at Jurong Fishery Port and key food facilities. Our fishery ports, Pasir Panjang Wholesale Centre, abattoir, and slaughterhouses are key nodes in our food supply chain. SFA has begun working with the companies operating in these facilities to implement SMMs since the start of the COVID-19 pandemic. Our objectives are to protect public health by minimizing the spread of the virus and to ensure business continuity. To minimize risk of infection from foreigners, contactless delivery for the truck drivers and boatmen was implemented. Controlled access to these facilities has been in place, with only workers and registered trade visitors allowed to enter. So public can no longer go there for look-see. Workers at these facilities have been encouraged to get vaccinated quickly. To date, 76% of workers at JFP are fully vaccinated, while 86% have received at least one dose of vaccine. Unfortunately, COVID-19 managed to break through these defenses, with many cases detected at JFP over the past month. The cases further spread to the markets and hawker centres through the stall holders who had visited JFP. In order to break the chains of transmission, MOH made a difficult but necessary decision to close JFP for 2 weeks, from 17 to 31st July, with all 604 workers issued quarantine orders. Investigations by MOH and SFA are ongoing to determine how transmission had taken place in JFP, and we've all heard from Minister for Health earlier on. We are not waiting for that investigations to complete because, as Minister Ong has mentioned, it is important for us to act immediately to protect public health. So, on our own, our preliminary review has identified some areas for improvement. First, the humid and laborious environment made it uncomfortable for workers to wear their masks for a prolonged period of time. This meant a higher propensity for workers to adjust their masks or take them off momentarily. Second, the workers could have taken off their masks while they take their breaks, smoking breaks, for example, and socialize in close proximity. Third, JFP being a marketplace meant that the workers and traders mix freely throughout the facility. It's just like a market that we are used to. Shoppers going around, traders going around, and sometimes between stall holders, they mix as well as they move stocks from one to another. Some contactless delivery measures were not strictly followed. Finally, we are investigating the possibility of format transmission in JFP. We will address these areas in our SMMs with practical solutions and enforcement before we reopen JFP. The first round of deep cleaning of JFP was done on 18 July, and we will be conducting another round before it's reopened. Common areas and crates will be regularly cleaned during its operation. SFA will work with companies to implement 7-day rostered routine testing, or RRT, for all workers at JFP. and all workers will be encouraged to get vaccinated. Contactless delivery protocols for truck drivers and boatmen will be stepped up. Trade visitors who are not on any COVID-19 testing regimes, such as RRT, will be subjected to an antigen rapid test, ART, before entering. More frequent patrols will be carried out to ensure compliance with the SMMs. Working closely with MOH and informed by their epidemiological investigation, we will adjust these enhanced measures if necessary to better protect both the workers and trade visitors. SFA has audited the SMM at SFP and PBWC. It will progressively cover all the other key food facilities. One-time PCR swab tests of all workers is being carried out. We are almost at the tail end. I'm very glad to report that we are not seeing big clusters in these facilities. 7-day RRT and enhanced SMMs will be rolled out to these facilities as soon as possible. We will monitor the operation closely and take enforcement action for any non-compliance with the SMMs at these facilities. An alternative site is being made available for use in the event of another closure of the fishery ports or PPWC. The Delta variant is a formidable foe. Collective responsibility is required to keep everyone safe. Next, on assistance extended to JFP and related businesses, the relevant agencies are working with companies to provide the necessary assistance during this difficult period. We have been facilitating companies to redirect supplies directly to the supermarkets, distribution centers, and retail outlets so that they can continue operations despite the closure of JFP. We are also coordinating closely with the companies to ensure that their workers have been swabbed and are healthy before we resume operations at JFP next week. As announced by the Ministry of Finance last week, the government will provide an additional 4-week rental waiver for qualifying tenants on government-owned commercial properties. Eligible workers and self-employed persons can apply for the COVID-19 recovery grant temporarily. Those under quarantine can also apply to the Ministry of Health for financial assistance under the Quarantine Order Allowance Scheme. And as to the support for stallholders in markets and hawker centres, the government is committed to support our hawkers and work with them through this difficult period. A one-off cash assistance of $500 under the Market and Hawker Centre Relief Fund will be disbursed to each stallholder of cooked food and market stalls in centres managed by NEA or NEA-appointed operators in August. Stallholders need not apply for this relief. The money will be directly credited into the bank accounts of the stallholders. This is on top of the 3rd month of rental waiver and subsidies for fees for table cleaning and dishwashing services provided this year. Those under quarantine can apply for the Quarantine Order Allowance Scheme, and those eligible may apply for the COVID-19 recovery grant temporary. For hawkers that continue to face financial issues, they can also approach NEA, who will review their case and provide case-by-case support. On Ms. Nadia Samdin's question about measures to improve safety at our markets and hawker centres, NEA will be putting in place tightened SMM at all markets and hawker centres to ensure that they remain clean and safe for stallholders and patrons. Bearing in mind that many of our hawker centres and markets are frequented by elderly patrons, so we are taking extra precaution to make sure that their health and safety are protected. So we will carry out rostered routine testing for stallholders once every 14 days. We will facilitate the testing, such as setting up more quick testing centres as announced by MOH, and explore teaching hawkers to conduct self-testing at steady state. Mandatory safe entry check-in will be implemented at all markets and hawker centres managed by NEA or NEA-appointed operators to facilitate more effective contact tracing. We have previously introduced e-payments to go cashless and will encourage hawkers and patrons to use this mode of payment to minimize contact and also possibility of formite transmission. About 90% of those working in markets and hawker centres, this includes our stallholders, our hawkers, as well as our cleaners at the centres, have received at least one dose of the vaccine. So it's very high vaccination rate, 90%. And we are calling up, encouraging those who have yet to do so to go for vaccination as soon as possible. While we will continue to ensure the cleanliness of our hawker centres through regular cleaning and disinfection, I also want to remind all patrons to adhere to SMNs and to observe personal hygiene. When dine-in resumes, patrons are reminded that they can do their part by returning their own used trays, crockery, and litter to help create a cleaner dining environment. Thank you, Deputy Speaker.
Dr. Tan Wu Meng.
I thank the ministers for their statements. By way of clarification, I would like to raise 3 questions. A number of Clementi residents feel very much affected by the recent outbreak. Our central market has had to close. Many worried parents, seniors, families concerned about the way forward. The first question is relating to the Jurong Fishery Port cluster. What measures can we take to better identify workplaces that may have a higher risk of transmission compared to elsewhere? 3 weeks ago, I filed a PQ on detecting COVID virus in the built environment. Can I ask the task force what efforts are being made to look for other areas and workplaces that could be potential hotspots, but which have not yet come to surface, but which are still at higher risk? Second question is on our schools. A number of Clementi parents have been watching the reports of some schools having students infected, possibly by transmission at home, and they want to know, given the Delta variant, what measures are being taken to maintain the safety of students, especially younger children who are not yet able to be vaccinated. For example, how soon can we roll out breathalyzers and tests which are easy enough for a child to do themselves? And thirdly, third question, sir, even as we open up and transition, I ask the ministries that we must maintain many of the capabilities built up during this pandemic and internalize the lessons learned, because we know that a worse variant of COVID or even a future disease X, a worse pandemic, is just a question of when rather than if. So I thank the ministers for their efforts, our public servants for their efforts, and I seek these questions as clarification. Thank you.
Minister Wong.
So on the 3 questions, firstly, we are constantly looking at the landscape to identify areas of risk where we might want to take greater attention. I would say there are 3 broad criteria. Number 1, anything that interfaces with the outside world is at risk, and therefore we take greater attention. That includes our airport, our seaports, the different interfaces with the external environment. And there we want to put greater precautions, safeguards, including regular testing for the people who are working there. Number 2, any domestic or local activity that has high-touch interactions with many people and where people are not wearing masks or potentially are in an indoor environment. And that includes dining, it includes your spas, massage establishments, your beauty services, and that's why we have also identified this as higher risk settings, and we have asked the people who are in these settings to be put on a regular testing regime using the antigen rapid test kits. Thirdly, it's an assessment of areas where we think SMMs may not be effectively done, right? So, we look around and there's a qualitative assessments, our SDAs are out there, enforcement officers are out there, and if we see that potentially in this particular industry, in this particular work site, SMMs are not followed, then that raises alarm bells and we want to take a closer look at that. So this is constantly being done, and we are always looking at potential areas of risk where we would want to put more attention or require more testing to be done. On schools, that's also something we are watching carefully. I think the school protocols have fortunately been very tight. Up to now, in the recent outbreaks, we have not had school-based transmission. We've had students who have been infected from their home, from family members, but not yet school-based transmission. We hope that can continue, and that's in part because our schools have been very stringent in keeping and complying with these protocols. But still, beyond just having safe management measures, we would certainly look at putting in place a testing regime, especially when there are more convenient methods of testing which can be scaled up. And then finally, we completely agree with Dr. Tan's point that we have to continue to build up our capabilities, because the battle is not over yet. New variants, future pandemics, we just have to continue this process of building better capabilities to protect ourselves. Thank you.
Ms. Hazel Phua.
Thank you, Deputy Speaker. I thank the ministers for their statement. I'm asking this question on behalf of some seniors who've conveyed to me their frustration that while they are being urged to get vaccinated, they're unable to get an appointment for a Sinovac vaccination. I think we do have a group of individuals who prefer vaccinations using the traditional approach and have reservations about newer technologies. So given that we are especially concerned about vaccination for our seniors, what avenues are there available for these seniors who prefer the traditional approach? Are there plans to further expand the Sinovac vaccination? Thank you.
Thank you. I think first of all is try to explain to the seniors, which I have tried a lot, which is that the mRNA vaccine actually has been developed for many, many years. It's not something so novel and so new. It went through all the rigorous evaluation by different authorities and then approved. And so far, even in Singapore, a few millions have taken it, around the world even more, and it's proven to be safe and effective. Every vaccine will have side effects, including Sinovac, including mRNA. So it is a good vaccine, and as far as possible, we want to persuade everyone, including our seniors, to take the mRNA vaccine. But for those who simply not comfortable or they are contraindicated for mRNA vaccine and they want to take the Sinovac vaccine, we now have made it available under the special access route. They can make an appointment. It may involve some waiting, but they will eventually get their vaccinations. I've reported just now that 72,000 people have in fact gotten their doses, so it is possible. Minority, especially among seniors, only 10% chose or rather for all those who take the Sinovac vaccine and are senior above 60 years old, only 10% are Singaporeans. So the great majority of Singaporean seniors actually still prefer the mRNA vaccine. So make the appointment. Got to wait a while, but you eventually will get the vaccine.
Sorry, Minister, I should clarify that they actually tried to make the appointment, but they are told that it's fully booked.
Oh, it should not be the case, but if you can give me the contact, we are more than happy to help them facilitate and make an appointment. Yeah, there are 20 over clinics that are doing that now.
Mr. Liang Eng Hua.
Thank you, Mr. Deputy Speaker. Sir, businesses, especially the F&B sectors, are finding this start-stop series of activities really disruptive, and they are growing frustrations, low morale, fatigue setting in, and they ask why is the F&B sector seems to be bearing the brunt of each of the heightened measures. So can I ask the Minister, why did we reverse on the 19 July decision to have this fully vaccinated 5% dining? It appears to be a reasonable proposition where the diners among them are fully vaccinated, and this is indeed what the kind of scenario we're looking at. And with that kind of de-risking, why don't we allow that to continue? I would like to hear this from the Minister.
Mr. Gunn.
Thank you. I thought I spent half an hour explaining why we need to revert back to phase 2 heightened alert. Let me try again. I think when we introduced the 5-2 regime, we were prepared to went ahead with it, except when we found that there's a significant number of infection transmitting within the community, and the vaccination rate of our seniors are still relatively low. Therefore, the risk profile was significantly different from when we first started planning for 5-2 framework. And therefore, we have to make a very painful decision. I must share with you that we deliberated at length on this issue. Of course, one option is to proceed with it, come high water, hell or high water. But the risk that we are going to take is that you may see significant number of seniors being infected, and because they will still be unvaccinated, and they will still have risk severe outcome and even mortality. And you may think that, well, it's okay, then just don't allow the unvaccinated to go to the restaurants. But you must always also remember that those who go to the restaurant who are vaccinated may still be infected and bring the virus back home to the families where there are seniors who are unvaccinated. And therefore, it is important for us to weigh the pros and cons between proceeding with it or to make a painful decision to reverse the decision and to give us more time to allow the vaccination rate to improve, both general vaccination rate as well as the seniors vaccination rate. So we fully appreciate the challenges the F&B sector is facing and is still facing today until we are able to restore dining in. And therefore, we appeal to them to work with us. And I think we have been working with the Ministry of Finance to roll out support packages to help them tide over this period of difficult and challenging phase. And I think Minister of Finance and I met them and tried to understand their concerns and to also reassure them that we are aware of their challenges and we will do what we can to help and support them. And I must also say that the reason they are facing, usually face the brunt of our measures is because, as Mr. Wong pointed out earlier, they are front-facing and there's a lot of interaction within restaurants and F&B outlets. And the most critical difference is that the activities are mask off, because when they eat and drink, they have to remove their mask. And therefore, it is one of the very high-risk settings, and therefore we have to be extra careful and exercise additional caution. And unfortunately, when we have to tighten our measures in order to protect the community, the F&B will have to work with us.
Mr. Gerald Giam.
So according to the MTF, the infections in the Jurong fishery port cluster were likely introduced via the sea from Indonesian or other fishing boats that brought fish into the port. And the exact mechanism for transmission is unclear up to now. Were these foreign fishermen required to take any COVID-19 tests or be vaccinated before entering the fishery port? And if not, can this be introduced immediately to prevent further import of the virus from countries where the pandemic is raging? Next, regarding the Sinovac vaccine, is the relatively lower efficacy rate of the Sinovac vaccine the reason why, compared to the mRNA vaccines, is that the reason why those who got the Sinovac vaccine are not considered fully vaccinated in Singapore? This lower efficacy rate has been known for some time. So why didn't MOH make this clearer? Make this known clearer so that they will not be giving the same recognition to Sinovac as the mRNA vaccine yet, for the purpose of differentiated measures, because this could have blunted the demand for the vaccine, which was mentioned earlier, and convinced more people to get the mRNA vaccines. Third, as we reopen our borders, many more foreigners will be entering Singapore. Are there plans to require vaccinations for both short and long-term visitors so that they don't inadvertently reduce our overall vaccination rate? And lastly, a recent British study found that a longer period of 8 weeks between vaccinations produces a higher immune response than a spacing of 3 weeks. Now, in our haste to get people fully vaccinated, where we are encouraging people to vote to book the second dose 3 weeks after the first dose, will we be compromising on maximizing durable immunity to COVID-19 in the longer term? Thank you.
Minister Grace Fu.
Mr. Deputy Speaker, I would like to address Mr. Gerald Giam's first question on crewmen. Indeed, I think that there
Minister,
is...
would you like to take your mask off? Or?
There is an hypothesis that the cluster may have punched through an Indonesian or through a fisherman on a fishery boat. That hypothesis actually has not been confirmed at this point in time, but we are not waiting for that. So we are looking at how to strengthen the SMM at the border. We have already started contactless delivery since April. That's along with the strengthened, heightened SMM at Pasir Panjang warehouse center, wholesale center. We have instituted that also for Senoko and Jurong Fishery Port. But with regard to the question about whether we should subject them to vaccination or ART, that's something that we are considering at this point in time. Whatever we do, I think we're looking for practical solutions where we can do it without increasing the risks. So if the crewmen right now, they're actually contactless, in other words, they are not allowed to land, they will stay on the vessel and they will use the vessel equipment to move their buckets of fish onto the shore, and then our shore workers will take it over. And we actually do not allow them to land on our shore. So if to subject them to tests, frequent tests, that may be a way for them to actually be landing more frequently on our shore. So we have to evaluate these options, look for practical and effective solutions.
Minister Ong.
Thank you. A couple of questions. One on Sinovac. Actually, if one is vaccinated with Sinovac now, it does reflect in your health hub, and it brackets SAR. So it is recorded that you are vaccinated with Sinovac. I think the question is whether it should then be conferred the concessions. Should we have differentiated safe management measures? I would say that currently there are different vaccines, and every vaccines have different efficacy, and it would not be, from a public health point of view, it would not make sense to just treat every vaccine the same. I mentioned in my statement just now the efficacy of Sinovac against Delta variant, because of the places that it has been applied and administered, that data is still being built up. And at the same time, the key issue is that Sinovac, when it applied to HSA for PSAR approval, the data was not complete. But those data has now been submitted. So we have a lot of data now before us. That data on efficacy against Delta is building up. We got data in HSA. We will assess them robustly. And once, if it's approved under PSAR, naturally it will be recognized. The third question, if I get correctly, is if we allow travel lanes to open, whether we will ensure that travelers to Singapore are also vaccinated. And explained by Minister Lawrence Wong just now, I think we have to open up travel very carefully and step by step, and you don't want to inject infections that make things go out of control again. So what is a natural? So for example, we have unilateral opening for very safe regions, and so far it has not caused us community spreading, because we assess those regions and know that they are very safe. Next step is for those regions that have also controlled their infections and have risk level about same as us, we can, for example, open up for vaccinated travelers to and fro without the need for SHN, but require a series of tests. So I think whatever step we take, always make sure that it doesn't raise our risk level, but maintain or even lower our risk level. That would be our approach.
Mr. Alex Yam.
Thank you, Mr. Deputy Speaker. I welcome the MTF's focus on future differentiated treatment for vaccinated and unvaccinated. It's perhaps one of the tools in the kit to persuade, encourage, nudge and cajole those who are still considering. However, I wish to return to a suggestion I made at the very beginning of the national vaccination program, which is to consider making vaccination mandatory. A lot of effort has gone into encouraging Singaporeans to be vaccinated because it makes sense. And I therefore consider it our civic duty to be vaccinated if there are no medical grounds to refuse. Ultimately, the fear is that the freedom of a minority to choose not to be vaccinated will affect the freedom of the majority who have chosen to be vaccinated for the sake of themselves, their families, and the community. The second clarification I seek is with regards to effectiveness of trace together and safe entry for contact tracing. Over the last few days, with regards to the KTV cluster and also partially to the Jurong fishery cluster, we heard various issues, not so much issues, we heard some limitations vis-a-vis contact tracing because people who do not bring their phones with them or their dongles with them because of fear of being detected in certain places. So whether or not the MTF can comment on whether contact tracing has been made more difficult recently. And lastly, on differentiated treatment, I echo the comment that was made by fellow member Ms. Nadia Samdin. On differentiated treatment, while I welcome it, how will we eventually distinguish between those who knowingly avoid vaccination and those who do not have a choice, for example, the young and the medically excused? This is, of course, if we do not introduce mandatory vaccination. Thank you.
Minister Ong.
Didn't quite get the second question, so maybe Minister Lawrence Wong can answer that later. Whether we can make vaccine, I was busy copying the question. Whether we can make vaccination compulsory like we did for MMR and others, it's not time yet to think about that proposition, because as of now, the use of the vaccines is under PSAR, which is Pandemic Special Access Route. So under emergency use in the pandemic situation, to make it mandatory, I think is not quite consistent. In time to come, when COVID-19 is really endemic, maybe it's something, it's a policy that governments around the world will have to consider. On the third question, which is related to Ms. Nadia Samdin's question, how do we distinguish between those who knowingly choose not to vaccinate versus those who cannot get vaccinated? From a public health point of view, they are actually the same. They are equally vulnerable. And so from a public health point of view, we ought to treat them the same in terms of the differentiated treatment. If you are not vaccinated, to protect you, best not to join the big events. It cannot be that because your intention is different, we let you join. That would not make sense from a public health point of view. Having said that, as I mentioned earlier, we will think of measures such as you get yourself tested and you can join, or in time to come when our vaccination rate is very high and our collective resilience is so strong, we actually don't need much of that differentiation. Yeah.
Second question is on contact tracing, the effectiveness of trace together and safe entry. I would say generally, even in the recent episode, we've seen that the systems are in place. Most people, vast majority, are using the trace together tokens or app properly. Establishments are having proper gating, check-ins using safe entry. And so overall, we still find this to be very effective in doing timely contact tracing and ring fencing. Are there lapses? Are there people who abuse, who do not use the app and trace together? Yes, obviously there are. But by and large, it has still been very effective. And we want to make it even more effective, which is why for markets and hawker centers previously, we had not put safe entry check-in requirements for all markets and hawker centers, because we all know it's very difficult. It's open, it's porous, people come in from all the different places. So we only did it for the very popular markets. But now we are planning, based on the lessons we have learned and realizing how effective it is, we are planning to put in safe entry check-in requirements across all markets and hawker centers. It will lead to some inconvenience on the ground with many of your residents, and I seek members' understanding to explain to your residents why this is necessary in order for us to have effective contact tracing during this pandemic.
Sorry, Mr. Deputy Speaker, I missed out one question by Mr. Gerald Giam just now. He mentioned whether we are rushing dose 1 and dose 2 by keeping only a 3-week duration, and whether a longer duration will make the vaccine more effective. That is the hypothesis of one study. And the conclusion is not conclusive. There are many other studies that show that 3 weeks for Pfizer BioNTech, 4 weeks for Moderna is an appropriate duration and gap between dose 1 and dose 2 for good efficacy. So I think the conclusion is not definite.
Ms. Joan Pereira.
Thank you, Deputy Speaker. I have a SQ on the quick test centers. May I check if the quick test centers for the fast and easy testing can be opened for extended hours to cater to one-man operations and other businesses who may have to go for their mandatory swab test every 14 days outside of their operating hours? Thank you.
Answer is yes. I think the quick test center in time to come is likely to be almost a national infrastructure for living with endemic COVID. I can imagine buildings, employers requiring that their employees should be tested once every 14 days or 7 days before coming to work as a precaution, as part of living with COVID. And the easy way to do it, either you buy a self-test kit from the pharmacy or you walk into one of these quick test centers, do a self-swab, or do a breathalyzer test. And in that circumstance, I think we need to study the demand pattern. And if need be, we'll need to operate on more days of the week or for longer hours. Right now it's 5 days, 10 to 5, I think, because many of the F&B outlets find that weekends are not suitable for them. But we've changed, as we move into the next phase, and judging by the demand, we will have to adjust the timing. Yeah.
Associate Professor James Lim.
Thank you, Deputy Speaker. Earlier on, Minister Ong had noted that the vaccination rate was progressing at an impressive 1% per day, and that we could expect a 70% coverage by around mid-August and possibly 80% by September. Now, I'm wondering what the basis for such an optimistic projection is, in part because once we factor in the under 12 in the population, for instance, that wouldn't qualify for vaccination, you get something in the order of 10 to 12%. So it only assumes an 8 to 9% vaccine hesitancy share of the population. And elsewhere, it has been demonstrated that at far lower coverage rates, populations have seen a point of inflection where there's resistance. So I guess the question is, how will we get this coverage to this 80% that I agree would certainly be welcome?
The basis of projection is because we watch the number every day, I do, and that right now, those who have taken first jab is already 76%, yeah. And that is over the whole population, including those under 12. And you break down by age bands, it is well over 80, 85, 88%, except for the most senior group above 70. Right now is, I think, 73, 74%. So these are the 76%, thank you. So just based on who has taken first dose, and so long as they turn up for second doses, which they always do, they tend to, I don't think that will change. By the time we reach National Day, we should be close to 70% receiving 2 doses. And if we believe that that momentum continues, by September, I think there's a very good possibility that we'll reach 80%. Associate Professor James Lim is right that if that comes about, that means vaccine hesitancy in Singapore is actually much lower in compared to other countries. And I think this is a function of us working together as a united front, as a united people, trusting each other with trust between government and people. And that is what helps us overcome vaccine hesitancy. We still have a lot of work to do for those who are older, but let's continue this work.
Dr. Lim Wee Kiat.
Thank you, sir. I have 2 clarifications. One is on Sinovac. I think when the task force announced that we're going to release a Sinovac vaccine to the people, many will rejoice. They're very happy about it. But this rejoice was short-lived after when you announced that the Sinovac, once you're vaccinated, is not considered as part of the national vaccination program. I also understand that there are overseas Singaporeans who have vaccinated with AstraZeneca, with other vaccines. And I think MOH is prepared to accept them if they do a serology test. And the serology test shows that they have immunity, they can be included in the national registry. So my question is that if a Singaporean receives Sinovac, if they're willing to go through a serology test, and serology test show that their immunity is there, can you accept them into the, register them into national registration? So when next month or the month after next, when the restrictions are lifted for the vaccinated, can they be considered as part of the vaccinated instead? That's first clarification. Second clarification is on the supply of vaccine. I'm very happy to hear that there's enough vaccine for all of us, and by September, we probably will hit about 80%. I read in the papers, our neighbors, JB, has about 23% vaccination as from last month, and I think in Batam was 23% and JB was 15%. My question is that, can Singapore help our immediate neighbors with the vaccination once we hit our 80%? Because if our neighbors are not safe, we are not safe as well. Thank you.
Thank you. On the issue of Sinovac, I explained earlier, I think the easiest, rather than doing serology tests and amongst our experts, there are also a different interpretation of serology tests. I think the easiest thing is to go back to what I said just now. As of 5th of July, Sinovac has submitted all the required data for us to do a proper evaluation under our PISA framework. So let HSA do its work. It's trying to do as fast as it can. It may take a month from 5th of July. And if Sinovac gets approved under PISA or other vaccines in time get approved under VISA, naturally, we will want to take a more inclusive approach in recognizing them. As for helping our immediate neighbor, all these purchase agreements have quite strict contractual requirements, so we can't take delivery and then donate to another country or region. And this all require us to discuss with the suppliers, but certainly where we can help, we will want to help our immediate region, because it is only when every country around the world and in the region recover from COVID that we can really be able to live with COVID as an endemic disease.
Mr. Xie Yao Chen.
I thank the ministers for their statements, and I am particularly heartened to hear the concrete roadmap that Minister Wong has provided as to how we will ease ourselves out of phase 2 heightened alert and the differentiation for vaccinated versus unvaccinated persons in this particular roadmap. The clarification I like to seek pertains to the longer term. So beyond immediate easing and reopening, when we are truly and well into a new normal of endemic COVID. Now, in this new normal, as Minister Ong has noted, we will have reached a high level of vaccination and therefore COVID resilience in the population, and the need for differentiation between vaccinated and unvaccinated persons will be less. But Minister Wong has also said that as we reopen, we must expect cases, the case numbers to rise. And so to take this a little bit further, in the new normal, there is still a possibility that we get a major flare-up in infections from time to time. And in such a scenario, the few hundreds of thousands or 500,000 persons or so who remain unvaccinated will be the ones at greatest risk of severe illness and therefore at greatest risk of loading our healthcare system. And so in such a scenario, I'd like to ask the multi-ministry task force, how might we tame the flare-up? And would the MTF then consider, in such a scenario, a sharper differentiation, albeit a transient or interim one, in safe management measures between vaccinated and unvaccinated persons so that we can protect the unvaccinated, but yet not cause a major disruption to normal life for the vast majority like we now have in phase 2 heightened alert? And more to the point, do we think we still need to pull back, to use Minister Wong's words, pull back sharply as a population from time to time in a new normal, or can we finally expect to see the last of phase 2 heightened alert? Thank you.
Minister Wong.
Mr. Deputy Speaker, sir, I've tried to give some clarity on what we can expect in the weeks ahead. Mr. Xie would like clarity in the months forward. And unfortunately, with the current situation being so fluid and uncertain, it's very hard. We don't have a crystal ball. That's why beyond, I said, early August, midterm of the phase 2 heightened alert, we have one move. When we get to about 80% coverage, we make another move, maybe in September. And beyond that, we will consider sequential moves. But each time we do so, we do it step by step, and we do it in a controlled manner, not a big bang. And whenever we make one move to ease, we monitor health outcomes very closely, precisely for the concerns that Mr. Xie had highlighted, that there will still be unvaccinated persons, and we are concerned that if, when we make one step to open, cases go up, we have to watch the health outcomes and the hospitalization and ICU cases. If these were to spike, then as I said, we might either have to slow down on the next step of reopening, or in the very worst case, if indeed a lot of unvaccinated persons, a lot of elderly turn up sick in the hospitals, then we may really have to pull back, as I mentioned. The worst case, in my mind, is when a new variant strikes. And I think no one knows exactly when this will happen, what sort of new variants we will see, but the risk is not trivial. And if a new variant emerges down the road that is much more transmissible, or worse, lethal, and more resistant to the current batch of vaccines, then it's almost like you are dealing with a new virus, frankly. And therefore, the defenses have all to go up again. So while we are embarking on this journey of reopening, let's understand that there are still risks, there are still uncertainties ahead, and therefore we are taking this controlled step forward, remain alert, remain vigilant, and continue to be flexible and adaptable in adjusting our posture based on the latest assessment of risk and the external environment and how the pandemic proceeds.
I'll take two more clarifications before closing the debate. Mr. Leon Pereira.
Thank you, Mr. Deputy Speaker. Just one clarification for the Minister of Health. There will be some individuals who get both doses and who still have very low resistance to the virus due to they being immunocompromised for genetic reasons or other reasons, or due to having certain risk factors. Is the government actively looking at, and this kind of relates to the PQ that I filed, is the government actively looking at giving a third jab to such individuals if the science actually supports that that will help them to raise their resistance to the vaccine? And I understand that the US Centers for Disease Control is actively looking at this question right now. Thank you.
If I'm not wrong, the US have not come to a conclusion, and neither have we. We are studying this actively, whether we need a third dose as a booster, when, and what kind of strategy, whether you use back mRNA or you use a heterologous strategy. So these are all being studied, and when the details, when we make a decisions, or when the expert committee has made the decisions, we'll make them public.
Ms. Tin Pei Ling.
Thank you, Deputy Speaker. Just a change to direct my question to Min Chan. Actually, I had earlier filed a PQ for a later sitting, but thank you for answering it earlier. So I just had a follow-up question, which is that given that there were rules to disallow hostessing, and yet there were blatant disregard for the rules, and now with the spotlight on these KTV or pivoted outlets, I'm just wondering whether there's a risk that more of these vice activities may then be driven underground to other settings, and therefore how will the surveillance and enforcement be stepped up to control this? I know Minister had addressed this in quite a detail, but just wondering how will the surveillance and enforcement be stepped up further given the current possibility, and especially in areas such as industrial spaces where perhaps offices or factory spaces could be used for parties at night. Some of these anecdotal feedback that we have heard as well. So to Min Chan, thank you.
Thank you, Ms. Tin, for that question. I think we have to rightly focus on the people who are the cause of the spread, people who operate illegally and the people who patronize. But look, before the pandemic, what was our framework? Singapore never made prostitution illegal because we knew that countries which have tried, and for thousands of years people have tried, it's not going to work. So you need to be realistic, what is doable and what's not doable. Pimping was illegal, pimping is illegal, prostitution was neither illegal then, nor is it now, except, I suppose, when there are safe distancing measures. When we allowed the nightlife outlets, pubs, bars, KTVs, those who wanted to pivot, what was our understanding of the situation? Supposing we had said no to all of them, there would have been a great deal of loss of jobs. But does that mean that immediately all dodgy activities would have stopped. Ms. Tin is right, precisely this issue. It would have gone underground much more, and it would have been very difficult to trace. So the pivoting is not the issue. The issue is that there is money to be made in making available these services. And there will always be people, because there is a huge demand, regardless of the rules, and there is, I won't say unlimited supply, but there is some supply. There will always be arbitraging opportunities, make money, and that's why flats, industrial spaces, warehouses, people organize. I mean, you would have seen in the newspapers they even organize illegal KTV operations. So we got to sort of remove the two issues. It's not that one is not connected to the other. The pivoting of some operators is not connected to illegal activities. They go on. And by definition, because of our rules, if all these activities are quote unquote underground, in the sense that they are not being open, and we have to go and use our intel to find and deal with them. Some are in these outlets, some are in outlets that are not obvious. We have to keep continuing at it, and whatever rules we come up with, this is not going to stop. It's just a question of whether it is more or less the activities. And, it puts a heavy onus on the regulatory authorities. We can urge everyone to be responsible, but as you saw from the example I gave, immediately after the unilateral opening was closed, there were many girlfriends turning up with Singapore sponsors with a variety of reasons. And this will go on. We just have to try and deal with them. Thank you.
Order. We have completed our proceedings on the ministerial statements on 5th update on whole of government response to COVID-19. Next is the ministerial statement by the Minister for Finance on support measures for Phase 2 heightened alert. Before we take the much anticipated tea break, allow me to say that the debate so far shows how we are all trying to fly our Singapore flag high throughout this pandemic. But I thought it would be good to invite this House to show its strong support for our Team Singapore in Tokyo, who are doing their best and their finest to fly our Singapore flag high at the Olympics. Thank you. And with that, I propose to take a break now. I suspend the sitting and will take the chair at 6:20 p.m. Order, order.